of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. Welcome, everyone. Public comment period. Does anyone have any public comments they'd like to address? No? Okay. We will look for approval on the June 7th board meeting agenda.
Madam Chair, I'll move the meeting agenda.
Moved by Schmidt, do I hear a second?
I'll second.
Second by Commissioner Bredesen. Any discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries. Now we'll look for a motion to approve the consent agenda. Do you want to go through it?
Yes. So, first we have approval of the May 17th board meeting minutes, approval of social services, county and hospital accounts payable, approval to hire full-time appraiser trainee Sean Kruth at level B22, step 2, $21.55 per hour, effective June 8th. Approval to hire full-time IT assistant Lou Nonscan, level B23, step 3, $23.56 an hour, effective July 5th. Reappoint Scott Klatt to the Sauk River Watershed District Board. Approve liquor license renewals for Manana Hilltop Tavern, Peters of Litchfield, and Milner Vineyard. Approval of a step adjustment for Deputy Corey Wells to 9DS Step 3, $28.86 an hour, effective June 14th. Approval of the 2022 Federal Boating Safety Supplement Patrol Grant Contract Agreement. Approval of the 2022 Medical Consultant Contract with Dr. Whitney Reentz. And approval of Gallagher Benefit Services Inc. Consulting Agreement as the health insurance broker. And that concludes the consent agenda.
Okay, can I get a motion to approve?
Move to approve the consent agenda, Madam Chair.
Motion by Commissioner Johnson. Do I hear a second?
Second.
Second by Commissioner Schiefelbein. Questions or discussion? Anyone? I have a quick question about the deputy. I'm just curious as to, I mean, I'm not opposed, I just wonder how we overlooked that. Was it just
If I may, from the Personnel Committee, when he applied, his application, he didn't change the data on there. He used a previous application, so it was incorrectly stated on his application as to where he was in his previous employment. And so we use that as the starting point. Am I stating that correctly? Yeah.
so he
Instead.
so he didn't put all his, I guess I'm
Didn't update it.
Yeah. He used a
on a
previous,
resume or what? Oh. Okay. All right. Any other questions on the consent agenda? If not, all in favor?
Aye.
Opposed? Motion carries. Thank you. All right, let's see where we're at. Barb. Hi, there you are.
there's Barb.
I'm trying to catch up on my agenda and there you are.
Before you is the spreadsheet that we've been doing a number of years to indicate the health or the collection of our taxes levied. So for taxes net payable on county funds, and obviously it's prorated out to the others, we had 15 million, and of that 8.6 was collected in May, which is 55.91%. And if you look at the 5-year history, we are above or near the average of collecting there with 55, 56, 55. So it's very stable, if you might say. And then if you look at the uncollected and the delinquent collections that we had there, as a percentage, being the number was lower than 2021, our collection rate is very stable to what history has shown. And so I'd like to make that report just to keep the commissioners on board.
Any questions for Barb? Thank you.
Thank you.
Thanks, Barb.
well, we let you off the hook easy today, didn't we?
Part-time, approval, Brian Cruz. I'm assuming you're Brian today, Becky.
I am.
Welcome.
Good morning, Chief Deputy Becky Noel. So we are requesting approval for the part-time medical director position. We're requesting approval for the community paramedic position, which we've worked with Fitch's office in getting that established. We're requesting approval of the sale of our current canine asset, Chase, to the city of Eden Valley. And then we're requesting the ability to purchase a new canine. So the sheriff's office's requests.
So we're gonna take these as a lump or individually?
No,
Individually,
I
yeah.
think individually.
So the medical director position and the community paramedic position are really linked. So both of these we had contracted with HCMC, the Hennepin County Medical Center, and both of which our contracts have been canceled by HCMC. The community paramedic provides a lot of services that benefit both the sheriff's office and social services. And Paul can certainly talk more about exactly what those things are. We've looked at a variety of options of how to continue on with that service and determined that hiring a staff member is what's gonna be able to allow us to continue the program in the way that we feel is best fit. In order for us to do that, though, we do have to have a medical director to oversee those medical functions that the community paramedic does. Additionally, that medical director will provide, medical direction to the sheriff's office for a variety of other functions that they perform, including the CSO paramedic positions that are, it's a separate program that they do. The medical director position, we looked at a variety of options here as well and determined that a part-time casual position is what will work best for us in the near term. That position, we have an individual who's worked for us as a part-time deputy and has served in this role, who we feel would fit in well with that. The community paramedic position, we will go out and do a search for, although we believe that there's a couple of folks who would be interested in that position. So, Paul, do you want to talk a little bit about how the community paramedic position fits into your realm of stuff?
Yes, we use it significantly for outreach for individuals that may be experienced or may be vulnerable adults. We get the reports that come in, says the person is a vulnerable adult, but there may not be maltreatment, and so they do engage the community in that way. It's also a part of us developing a community milieu for persons that have mental health issues, that may have some medication and management type difficulties, don't want to access the full services or are not eligible for a full boat of services, but just need some medication management. As we look to the future, that's going to become more apparent. We'll continue to provide the board with more information about what that will look like for our community. In particular, for those folks that are deemed incompetent to stand trial, but don't meet the criteria for a civil commitment. Those are individuals that we're looking to support with the community-based paramedic. An example of the situation that we've used the community paramedic for in vulnerable adult is we receive a report. The individual is unknown to us. The community paramedic can start to develop a relationship with that individual. We've seen great success in that occurring and getting that person engaged with services and supports that will continue to allow them to live in the community. The funding for the position is based off of a current budgeted amount of $35,000 for the sheriff and $35,000 for social services to cover the cost of the position. We've been having conversations with Prime West. Prime West, we haven't ironed out all of the details, but we're pretty clear that we'll put $35,000 towards this position as a pay up front. Then social services will bill Prime West for whatever is covered by them as far as the duties that the community paramedic will do, and then we'll pay back down that $35,000. So it's a prepay kind of arrangement, and that's going to give us a good understanding of exactly what the volume of service that Prime West will that this position will do for Prime West. Community-based paramedic as you well know, there is some procurement going on, and there may be multiple sources for PMAP or MA population. This is a covered service underneath all health plans, so it does fit with that. So regardless of the landscape there, we would be just billing other health plans. We may not get that $35,000 up front, but we believe there's enough work to overcome the $35,000 with some to spare as well.
Correct me if I'm wrong, but we have to have, I mean, I'm just by the level of service that the deputies provide that I've witnessed, we have to have a medical director regardless, assigned.
We do.
I mean, we have to. So that isn't, and then is the community base, I always get these confused a little bit, but this is also the paramedics that are on patrol some too, are,
They are, and they respond when we have
Yeah.
emergencies. And so you've seen them out on fire calls or, rescue calls.
I gotta bring this up again, and I didn't know this was coming on the agenda, but and I've said this before, but the other day, we had a call in Watkins Ambulance, Dwayne Peterson, who's been on there for 50 years plus, basically got me up against the wall and told me, was complimenting me, but he was about this far from me. He said, "You tell the commissioners how appreciative we are of the position that you guys are supporting," because they had one of their prior Watkins ambulance members went down in a cardiac and the paramedic was there, and he said, there are things that, he said 20 years ago, the level of care that's provided now on scene is off the charts. He said a lot of these people wouldn't be alive today if it wasn't for programs like that. So I mean, I kept telling him, I've been telling him, I've been thanking him. So he was, but like I said, had me up against the wall. So it's a good program.
And in relation to what Paul said, regardless of the landscape, I did have a chance to talk to Jim Prisbilla about it from Prime West. And yes, they believe in this program. They think it's a good program. So very supportive from that standpoint.
Okay, so we're looking for a motion to approve the hiring of a part-time casual medical director.
I have another question. This is a position that had been contracted out through Hennepin
Yes.
County. We'd worked with them before,
Hennepin County Medical Center,
the medical center.
the hospital.
And that individual that we worked with served many counties? Or,
On the medical director or on the community paramedic?
on this part-time casual person?
The medical director? I'm not certain how many counties he served in
I
that
believe
capacity.
Meeker County was the only county.
He's the chief of their emergency department.
And they've elected not to do that anymore, not to farm out those services.
Yes, specifically to law enforcement, yes.
Would this be a position that we could share with some of our neighboring counties?
So that is one of the things that we've taken a look at
Yeah.
within Meeker County for rescue squads and other entities that may require a medical director. And I know the sheriff has started to have some conversations there to try and, defray some of the costs that comes to the county. So yeah, that's an option that we're looking at.
Okay. Okay, but wouldn't be something that we could share with, say, Candy, Ojai County?
I mean, potentially,
Oh,
potentially.
This person has a full-time job managing the emergency room down at HCMC. And so he also is a part-time Meeker County Sheriff's Deputy, who then also plays the role of being a medical provider. So it's a rare opportunity for Meeker County, and so I don't think we can for sure say that he's going to expand his resources to other counties yet.
Yeah, it's based on his capability, his capacity, but being that we're the only potential defraying of cost that we would see is on the insurance side, because we're gonna be billed on an hourly basis for the amount of time that he's spending with Meeker County, so.
all right. So what we're voting on is not necessarily an individual today. We're voting
Correct.
on
Creating the positions.
creating this position.
Yep.
Yeah, okay.
Any other questions before we, for a motion?
Move to approve part-time casual medical director position, Madam Chair.
I'll second, Madam Chair.
By Commissioner Johnson, second by Commissioner Schmidt. Any more discussion or questions? All in favor?
Aye.
Opposed? Motion carries. Full-time, approved full-time public safety community paramedic position. Is that,
Yeah,
Or
so
we just
we've
same-
basically discussed this already, so if there's other questions, I'd be happy to answer them. But
so we're gonna move on to the sale of the K-9?
we would still need a motion on that.
I'll make a motion to approve
I
that.
thought this was all, okay, I'm very confused right now. So
It's two-part.
it is two parts.
Yeah, there's two separate
Okay.
positions, yeah.
One's a medical director.
Right,
this is
that's what
part-
I thought, but I thought.
My
we-
motion will be for the or for the, community paramedic.
That's a full-time position.
Yes, sorry.
And I'll second that motion.
Motion by Commissioner Schmidt, second by Commissioner Schiefelbein. Any questions? I have some, but I don't know what they are now, so we'll just move. For some reason, I thought we were voting on, anyway, all in favor?
Oh,
Aye.
discussion.
I just asked, do you have any discussion?
Yep, I thought you were gonna ask a question.
Oh, no, I
Oh.
was just being,
Oh, okay.
just pulling a Danny.
Pulling on me.
Oh,
Nice to know I'm verbiage now.
action verb. Well, yes, I had a question. I was looking on the front page of the request, and I think it's just a typo, but it says that the full-time position will cost $100,000, including salaries and benefits. And Paul, you said that we have 35 from one entity and 35 from another for a contract of 70. So wherein will come the additional 30,000 then?
That's the relationship that we're going to have with Prime West
Prime
for
West.
another $35,000 for at least the first year. And then what we would do is we would bill for those services to buy down that 35,000. It's our expectation that there's going to be enough work to ongoingly cover that portion of the costs of this position through billable service.
Okay.
And if there isn't, you know, if this becomes a huge cost in a few years, we'd look at it differently, right?
We would look at it, yes, and we would also have better data as to the benefit of the position to make decisions. But I would like to see for sure that we would get down the road a little piece with this. Anecdotally, we know what it's been doing.
Right.
We've only had one day a month,
One day a week.
And for sure,
one day a week, excuse
One day
me,
a
sorry.
week.
for sure, Prime West is into prevention. And
Yep.
this is gonna be part of that, I think, down the road. What we always talk about is, can we get to it before it becomes a massive issue, right?
Yes,
Exactly.
and that's the intent of all of the services that
Right.
we're intending to provide.
So to explain the numbers a little bit further, $100,000 is the anticipated total cost for the position. Currently in the budget, we have a total of $70,000 because this was a contracted service through HCMC, and we sought to expand that service this year. As Paul had mentioned, there's going to be an opportunity to pay back some of that through billable hours, through health plans. And so we're gonna pursue that as much as we possibly can. But yeah, there will be an impact on the
And for context, for HCMC, wasn't it almost $70,000? Or what was that contract?
We were
for this?
spending $70,000 a year for one day a week. And what we're proposing is a 5-day-a-week service.
I think that's good for context, so everybody understands what we were doing before, and now we're actually getting a lot more bang for a buck.
Exactly, sir.
Thank you. Thank you.
Any other questions?
The other comment I would make, if you ever witness what these community paramedics do, it's, I mean, short of doing open heart surgery on a living room floor, I mean, these guys can, it's amazing. I mean, it's hard to put into words what the impact that they do have. So, I mean, even if it is an increase to the budget, it's a public service that we owe the public out here for public safety.
And this will be a position that we will advertise for, and we don't have someone directly in mind, but, okay.
We're vetting this process through the class and comp thing. That's why I know a little bit more about it. That's So, just for clarification.
Yeah,
Thank
we,
you.
and we felt good about it coming through personnel too. We were on board, so.
Any other questions? If not, we'll take the vote. All in favor?
Aye.
Opposed? Motion carries. Okay, approval of the sale of the, let me move on here now. Existing canine for purchase of a new canine.
Yeah, so you wanna kick it off, or you want me to kick it off?
Well, we both can.
Okay,
You're
all right.
welcome to come.
Sure.
So, one of our deputies has currently accepted a position with Eden Valley Police Department. And he's been our canine handler, and we've had Chase for 3 years. You can retrain a dog with another handler, but it's probably better for the dog to remain with the existing handler. I mean, it definitely can be done. But Eden Valley has agreed to, pay us for Chase, which gives us an opportunity to continue our canine program, and we would, put it out for another deputy to step into that position, and we would obtain a new dog.
Yeah, and just to add, by the way, I'm Brent Bankston, I'm the mayor of the city of Eden Valley. Thanks for having me here today. Just to add a little extra onto that, as part of looking for the new police chief, our current chief is gonna be resigning at the end of June. And we decided to, hire, the current canine deputy here for Meeker County. And, as part of that, he did ask if it would be okay if the city would evaluate that. And after doing a few workshops and talking it through, we thought it would be a good asset to the city of Eden Valley. Also would be, still be made available for the county, for Meeker County also. We don't wanna take any of that away. But we also looked at it as an opportunity to, like she said, to be able to keep the dog and the handler together, even though it can be done. We took that into account also, that, the well-being of the canine itself. And then also just an opportunity for us, because we're gonna be in a rebuilding phase of our police department, and using that as an opportunity to increase, or, add additional services, different avenues that we can do for public safety.
How does the dog feel about it?
Yeah.
I tried asking him, but
No answer?
Face like this
he just
idea.
waved his tail.
Moving to Eden Valley.
What we need is a dog whisper like Beth said. To relate to the dog, the little boy.
Dog whisper.
And both officers live, the dog and the officer both live in Eden Valley currently, so.
So they're Meeker County
Dad.
taxpayers.
They're on the other side of the
Well, they
street.
are, right?
Oh, yeah, on the
Literally, they're 15 feet.
Okay, moving
The
along.
dog will use the restroom on the Meeker County side.
Wait a minute.
The high
Is
school.
there an ordinance dealing with that?
Do we have any other questions? Otherwise, I would look for a motion.
Madam Chair, move the sale of existing canine asset and purchase of the new canine.
Do I hear a second?
I'll second, Madam Chair.
Motion by Commissioner Johnson, second by Commissioner Schmidt. Any discussion, questions?
Do we have a
Julie?
deputy now who is interested in taking on the role of being a canine person?
I believe we do, but we would open it up for all those who are interested to, interview for that.
Okay, all right.
What's the timeline on getting a new canine?
Well, I believe the, next course starts in August of this year, and so,
Be ready to go then?
yeah, we've been in contact with him, and he's just in the process of going to pick up a new, batch of dogs. And
Sure.
so,
Okay.
he told us to get a hold of him as soon as we received approval, and then
Good.
we could attend that August class.
Any other questions, anyone? If not, I'll call for the vote. All in favor?
Aye.
Opposed? Motion carries. Thank you, guys.
Thank you.
Good to see you. Yeah.
Andrew, are you gonna be Phil today?
I can be. I got a message from him saying
For
he's
me.
on his way, so we can do that. So the first item we have today is approval of the 2022 bulk fuel quote. We had 2 quotes come back from Petro of Litchfield and Central Counties Co-op of Litchfield. And it's recommended that the quote be awarded to Dooley's Petro of Litchfield. Estimated price of $151,630 on 35,000 gallons of diesel fuel.
The bulk diesel, it was interesting to look at last year's quote, wasn't it?
Absolutely.
$2.36 a gallon.
As I think we've all seen, the market has quite exploded in the fuels realm.
Have we, going along them lines, I know we discussed at one point expanding our bulk fuel for other agencies, county vehicles. Have we looked any deeper into that?
So what we've, Phil and I had a conversation about this yesterday, actually, and what we've talked about is, we need the facility at Litchfield in order for us to really be able to do that, because this bulk fuel is what's going out to the different out shops, and it's diesel. And so we've talked about when we do some sort of a project at the Public Works building, that would be the time to install, a depot
More of
there,
a
yeah,
depot,
a fuel island there, which would allow us to have tanks for diesel and gasoline and, allow other county vehicles to purchase there at the bulk fuel price rather than the retail price.
Okay, any other questions? If not, I'd look for a motion.
I'll make a motion to approve the Dooley's, buy the bulk fuel from Dooley's.
Right here, second.
Second.
Motion by Commissioner Schmidt, second by Commissioner Schiefelbein. Any other discussion?
Well, just one question. The bulk fuel prices paid will fluctuate with the published price. So if we contract for $4.33 and the price continues to rise, do they hold the $4.33, or it's going to fluctuate and go up with?
I believe it's gonna continue to fluctuate.
It's a spot price. When they do them quotes, they have to give them a quote. They give them the day, and
Yep.
you set the quote off that day, and that's a projection.
Yeah. Kind of figured that. I didn't think we were gonna get $4.33 if it turned to $6 fuel.
Correct.
Per
So-
year. Yeah.
Correct.
Any other questions?
But alternatively, we won't pay $4.33 if it goes down to $3.
That's right.
All in favor?
Aye.
Opposed? Motion carries. Oh, the highway right-of-way spraying quotes.
Yep, second item is the approval of the 2022 weed and brush spraying quote for the county highway rights of way. We only received one quote this year from Snowcats of Kaikato for $45,024. It's recommended that the contract be awarded to them. There's a map included in your packet which shows the locations, and as you can see, there's a wide variety across the county.
I questioned why only one quote? We had a couple last year and the price has more than doubled. We added 20 miles to the route, but I'm curious why such a large increase. And I was going to ask Phil, but
Well, I will say this, and he can certainly answer. We have never had a lot of quotes for this over the years. The licensing changed a few years ago, right, Commissioner Schmidt?
It's,
And people just aren't quoting it like they used to.
we always had trouble on the township too, just getting interest. I mean, the co-ops would do it, but they were reluctant
Yep.
to do it. I mean, it was hard to get them to do it timely, cause they're busy doing other
And then if you
spraying
don't
crops.
get the weeds at the time, it doesn't do any good.
Cause they
So-
wanna do it now, well, everybody's spraying now, and I'm assuming they're burning fuel, so I mean, that's one
Yeah,
reason your quotes.
I mean, that's a
I think
big.
we're gonna see this everything. in
I think that's,
everything.
I think the fuel price is a big thing of it. When you look at the 124 miles that we're doing, most of this job is driving, right? They're driving and spraying. And so I don't know what the chemical costs have looked like. I wouldn't imagine that they've also gone down. And so that's likely where we're seeing the increased costs from. This is a company that did not bid for us last year, but my understanding is that we did send this out to multiple companies looking for pricing, so.
And I'm wondering if some of the townships are scheduling with these people. We've had
Potentially.
discussion over the years of the township, if they let them know. But there again, it's like Steve said, then the township wants them done at a certain time and then you can't get them done. It's been a problem for,
And this would be a Phil question, it's possible that some of this, they could be piggybacking with some they could
they've
be doing
tried to
some
do that over the
townships.
years, but the timing has been an issue over the
Well,
years.
and that's, the company who's bidding on this they know what their schedule looks like. They know what other contracts they have. And so, oftentimes, and Phil has talked a lot about this, a company who's already doing work in an area may become more
Right.
aggressive on a price in order to be able to
'Cause they're
get
there
more
anyway.
work in the area because they have less setup costs and all that sorts of stuff. So.
Any other questions?
And there was an additional 20 miles
Yep.
Yep,
last
Yep.
year?
We added
18 miles, but yeah.
18. All right.
Madam Chair, I move to award the 2022 highway right-of-way spraying to Snowcats LLC of Coquito for an estimated price of $45,024.
Motion by Commissioner Shifelbein, do I hear a second?
I'll second that.
Second by Commissioner Edison, any other discussion? All in favor?
Aye.
Opposed, motion carries.
So then I would suggest is that we skip over the annual report. We come back to that, the presentation.
That was just exactly what I was thinking.
Fantastic.
So we'll call on the call on the.
Sorry
prime
about that,
health-
Andrew. That's a scary proposition. You two are thinking the same. Whew.
Doesn't happen that
No.
often, trust me.
Oh. Probably wouldn't sleep for a week if I thought of that was happening.
Hi, guys.
Morning.
How was your drive? Wet?
Good. Just a little drizzle on the way down.
So an interest.
On your way back, stop in El Rosa at Bucky's Bar,
Yeah, and buy some of them garlic pickles.
garlic horseradish pickles.
All right.
I got introduced to Bucky's Bar on the way back from investment. So, because.
You
we're
don't wanna
record-
elaborate though,
No,
right?
I'm not going to. Paul was driving.
What time did you guys get home?
Yeah, you start eating those garlic
And the
ones.
cameras
I
are
can't
rolling,
stop.
we'd
On
like
your
you to
per diem
introduce.
Yeah.
per diem for lunch.
Good morning. Thanks for having me. My name is Matt Magnuson. I'm the Director of Member and Provider Services at Prime West Health and also the Director of the Prime Health Joint Insurance Pool.
And I'm Leah Klitzky, I'm the coordinator for Prime Health.
So we're here today to talk about Prime Health, joint insurance pool that Meeker County is a part of, one of the founding members of. I do have a presentation, but really this is more about questions and answers too. So if we're going through here, if you have questions, answers, questions for me, just kind of jump in and we'll go full. You can feel free to interrupt me. Andrew, are you controlling?
Yeah, or you can do it on there too.
Okay. So we'll start with what is Prime Health. It's a political subdivision self-insurance pool. Basically, it was a group of counties that own Prime West, came together in 2018 and created their own pool. A new way of kind of buying insurance. At the time, there was only one other political subdivision operating in the state. So we were the second one that was ever created. It's a unique entity that's available to public entities like counties and cities to be able to share their risk to buy insurance. Today we have about 1,400 employees in our pool, about 2,700 total members in our pool. There's 8 counties and like 4 county-owned entities. So like Prime West Health, we're part of the pool as well as a county-owned entity. Horizon Public Health is another county-owned entity that participates in the pool. Pipestone County Hospital. Then we also have a nursing home out of Hubbard County that participates. That's county-owned. We do contract with Preferred One for administrative services. So although Prime Health or Prime West has its own claims administration, there was some concern when we were starting with counties because we do so much with public health and social services that we wanted to have separation of those duties so that when somebody was dealing with a Prime West client issue, when they were calling in, they weren't then calling back to deal with a personal issue with the same people. So we use Preferred One just as our administrative services. They basically process our claims and pay our providers. But we do all of the basic financial administration. Everything's completely transparent. We know exactly what Preferred One uses every dollar for and how much they pay providers. Why did we start Prime Health? Really, it was started for a few reasons, but the key one was long-term rate stabilization. I have a chart here in a minute. I'll show you what counties were experiencing before Prime Health and why they came to Prime West. So back in the day, a bunch of counties came to us and said, all right, we own a health plan. We're serving all these people. Why are we not using that health plan to do our own county employee insurance? And I'll show you kind of how that came about. But the other thing was just having that control. Where are we spending the dollars? Insurance companies typically make money. So by us owning our own insurance company, when that happens, we get to decide where that extra money goes. We get to reinvest it into to buy down employee premiums, add new benefits, whatever we want. And the other thing is financial transparency. We can see where every dollar goes. You know, as a county, that's an important part. We can see where every single dollar we spend goes, because health insurance is not a cheap thing. It's becoming more and more expensive all the time. You can have one member now who has a claim that's over $1 million, and you know, how is that possible, and how do we kind of control that cost? So when we talk about long-term rate stabilization, this chart here just illustrates, this is the years before Prime Health was in operation. We went out to the counties, we collected data of all of the current counties that are part of our pool, and looked at what were their rate increases, what were they experiencing over time. And so you can see on here that you have some years where people are getting negative rate increases, so they get a -3, -4% increase, and then the next year they get a 15% increase. And so it was just kind of all over the board. It made it really hard for counties to budget. A lot of our counties back when we were first starting, we're talking about they negotiate their employee contracts or union contracts on a 2-year basis, but so they'd have a -2 in 1 year for health insurance, the next year they'd have a +20. It made it very hard for budgeting. So how can we take some of this fluctuation out of that? Can you click that slide again for me? So this has been the experience with Prime Health for all those same counties. So what we did is the whole point of this thing was it's all for one for all. So we took all that risk that was divided amongst all those groups, combined it, and all the counties and groups within Prime Health now share that risk equally. So we're able to maintain this kind of flat, stable rate increases over time. That was the whole point of this. When we looked at the charts, we had some groups who were getting, like I said, 20% increases or a -2, but really the average across all those groups was right around 6%. So that's what we did. We took all those groups together, pool all that risk together, and then we can have a consistent, more predictable rate of growth over time. Now, you're still not controlling the cost of healthcare is expensive. It keeps going up. And we want to try and do things eventually to try to bring down the cost of healthcare, but that's dealing with provider negotiations, things like that. Really, you're not going to change too much about your cost to your employees, right? The cost that they're going to experience, that's why we all have insurance, it's what it's there for. Next slide. Just wanted to pull out just Meeker separate. We just pulled out Meeker just to kind of show you specifically your county, what the rates were before Prime Health and what they've been since you've been a part of Prime Health. So prior to Prime Health, you can see there you had, in 2012, you had a 2% decrease in your insurance rates. You went up to a maximum of 15.5% increase, and your average has been about 8.5% before you were a part of Prime Health. When we moved over to Prime Health, your minimum increase has been 4.2, but your maximum has been 6.4 for an average of about 5.1% for those years. The other unique thing with Meeker County was when Prime Health first started, Meeker County was one of the few counties that your rates were so high, you actually had a decrease in total employer premium when we started. It was one of the reasons that Meeker County was on board right away, is because when we started running the numbers, you could see there was a decrease in your overall premium cost when you joined the Prime Health pool. So how do we, why do we do things? How do we stabilize rates long term? A few things. One, I know this is the thing that comes up with every county, is it's a 5-year commitment for Prime Health. The reason we do that is because we're looking at this is long term. This isn't about we're gonna save a bunch of money next year. I can just about guarantee you guys could go out to the market today, somebody will come in with a better quote for your rates for next year. Right? That's how insurance works, but it's years 2, 3. What do you look like that? This is about a long term. This is not about next year. This is when we look out the next 5 years, where are we with insurance? Insurance is gonna fluctuate up and down. You're gonna have those ups and downs. This is about coming together as a group of counties, sharing that risk for the long term. That's why we create that 5-year commitment. It's because of that 5-year commitment that we're able to get rates to stabilize, like if you wanna go back to that one slide, that one, like this. Because we know we have time to make it up. So when we talk about having really high expenses, and we did when we started Prime Health, in our first year of operation, 2018, we had one claim, a premature baby that ended up being $2 or $3 million over the first year and a half. And it was because that big claim, but we knew we had 5 years to kind of slowly raise rates to kind of catch back up. That's the importance of that 5-year commitment. If we don't have to do a quick adjustment in the next year and raise everybody's rates 20% because we experienced this, we can just slowly do it because we know we have time to kind of recoup those expenses.
Yeah, Matt, you said that we started at a higher level, so obviously we had more claims going into it. And is that the beginning where we set our rate at the first part, where you know, if we didn't have a chance to decrease or anything. So we started at the high rate then?
Correct, yep. You guys
So that
started-
would help stabilize anything regardless. I mean, we didn't have a chance to go down at all though.
Correct, you did. So you started at a higher rate, so the way the pool works is we had eight groups and everybody kind of came in at different rates. And we couldn't bring everybody to the average right away, so I'm just gonna use easy numbers here. Let's say Meeker County was paying $800 for a plan, and there was another county that was joining that was gonna pay $400 for the exact same plan at the time. But your experience over time had been higher, so you were paying more. Well, if we were gonna start the pool and bring everybody to 600, sure, Meeker County would have joined right away, but all these groups down here with that low premium, they're like, we're not gonna do that, it's gonna be a huge jump. So what we did is gave everybody credit for kind of where they were. And then over time, we're slowly kind of bringing those groups together. So when I said there was a 6% average in the pool, what that meant was if in a year where the average truly would have been 6%, the group at the high end, let's say that's Meeker, would have got an 4% increase in their rates, so they'd have been slowly coming down. The group that was the lowest price group would have gotten an 8% increase, so plus or minus 2 from the average to slowly bring those groups together. And that's how it gets that chart to look like that. That's why everybody has a little variation in their total rate. It's not truly a community rate yet, because we're still trying to bring those groups together. So yes, Meeker County started higher and you have remained higher, but your rate of increase as you've been a part of the pool has always been lower than the average cost of the pool increase too. So you kind of lock yourself into that as well.
And what was our, basically, we had to buy into this. What was our initial cost?
I don't
For
remember.
each, cause every county was the same, right?
Yep. It varied based on the total number of employees. that
Oh,
were
okay,
joining.
so it was proportionate to,
Yeah.
gotcha.
Right, and I think our total amount across all, and originally all 13 counties in Prime West invested in it was around $200,000, so it was divided up, that $200,000 was divided up amongst those 13 groups based on their total number of lives.
Okay.
So, 50,000, something like that.
I thought it was higher than
I feel
that.
like it was more than
Maybe,
that,
maybe it was
but I can't tell you right.
86.
I was gonna say a
I
hundred.
don't know where I'm
Okay.
going.
But whatever, I just,
But I remember we had this
yeah, I
discussion.
thought,
It went by, per capita, right?
Yeah, it was based on the total number of potential lives, and it was for the development those first
Right.
years. So I think you invested in like 2015 or 16 for our development years.
Okay.
To get going in 2018.
But everybody
Everybody did.
entered.
yeah, it was proportionate to the number of employees, gotcha.
So, yep. We share risk equally, that's another way we stabilize rates, like we talked about, this is truly all for one for all. So in that case, when we look at those rates, there might be a group that had that really high case, it might just be one group. And that was the other thing, when we looked at the data, you didn't know which group that was gonna be, right? So, it doesn't matter if you're this group up here that spent 50% more than we took in total premium, you're not gonna get a 50% increase. You're gonna get whatever that group average rate was. We're constantly monitoring and maintaining pool health. I have a slide here coming up, I'll show you what that looks like. But what we wanna do is make sure that the pool itself stays healthy. When we were looking at groups that were out there, some groups, family rates, for instance, had gotten so expensive at some counties that they had no families participating anymore as a part of their county insurance pool, because their family rates had become so unaffordable. And when that happens, the risk of their overall pool really shifted to be a really high risk. So they were just in this kind of trap, it's called a death spiral, where the rates kept going up and up and up, and more people kept dropping. The only people that were left were people that had really high claims. So we constantly monitor that. We have that unique benefit design. We spent 2 years that we talk about that money that we used, meeting with employees and union groups and county administrators and local insurance agents, and talking about what plans work, what didn't work, what was currently being offered, how could we make plans that fit that model. Meeker had some unique things that are part of this plan. You guys were always one of the few counties that had generous funding of like HSA and DEBA accounts. And we use that because a lot of employees, we really saw the advantage here. What was happening, that you guys had that kind of advanced funding of those accounts that a lot of counties weren't offering at the time. And what was that doing, and how was that changing the risk in your pool? We also kind of, again, this is about leveraging the health plan you own to do your administration, right? You already own Prime West Health. The way that Prime Health is operated is it's a whatever the cost is of employee time, of travel time, of coming out to do these things, it transfers right through. So it's a flat fee based on the total cost. Prime West Health does not make any profit off of Prime Health. We just transfer that through. Counties already own that plan, so whatever that cost is just gets shifted over to this plan. So we operated about 6.9% administrative rate in 2021. We operate the entire Prime Health pool.
Matt, what's a typical administrative rate?
They vary from that 7% to 13%, depending.
So we're
how
on the
you look
lower
at it. Yeah, yeah.
Thank you.
How do we benefit the employees? Again, we talked about the way that we designed them. They're set up to be employee-friendly plans. We really looked at current utilization and current plan designs and defaulted on plan designs that benefited the majority of your employees. So we looked at how were people spending their insurance dollars and how could we put money in so that they benefited the majority of people. And that's where that generous funding of those HSAs and VIVAs really comes into play. Because when you look at any kind of charts over time, if you kind of break up the total dollar spent, so 0 to 1,000, 1,000 to 2,000, 2,000 to $3,000 in total medical expenses, about 80% of the people end up being below $2,500 a year in total medical expenses. So we want to make sure that we're keeping the benefit good for those people, and that's where that funding of HSAs and VIVAs really comes into play. 50% of people don't even spend $1,000. So when we're funding an HSA at $1,300, those people are getting all of their first dollar coverage taken care of without any additional out of pocket, plus they have some money that's rolling over year to year. So that's why we do that. We have a rich benefit set, so I talked about, we looked at all the current plans. If they had coverage for certain things, we couldn't eliminate that. So we added those things in. So our plan covers things like bariatric surgery that aren't typically covered under employer plans anymore. We cover infertility treatments that aren't typically covered under traditional plans anymore, but that's because one county or two counties already had those benefits built in, so we had to kind of match those benefits sets. We didn't really cut or slash benefits. That's not what this is about. We have a really robust preventive drug list, so if you ever talk to employees or for anybody that's on Prime Health today, we have a really nice preventive drug list, and all those medications are free to people, and that's really been a really good benefit for our employees. Because it covers a lot of things, like one of the biggest ones is like diabetic medications that are covered there, are free on that preventive list, meaning people can get those medications without paying any additional money. They're free to them.
And
Again,
not to interrupt you, but I remember when we started the drug list, there was some issue, we had employees that couldn't, and I'm gonna say that Prime West worked well with them, and they all got them covered, because when you started out, you didn't know who needed what, and there was a couple people that had some high price things, and it worked well to be able to call people we know and take care of an employee, and that happened on more than one occasion, I think.
Yeah, and that's on our member-centric point. What we try to do is, so yes, we use preferred one, yes, call their customer service first, but if that doesn't work, you have this kind of middleman, and that's actually Leah is our person. And so a lot of employees call her and they're struggling with a bill, they're struggling with getting the medication covered, and she walks it through them directly with the employee and preferred one to make sure that those things get taken care of. So,
And I think it makes a difference.
yeah.
I just think it does, so.
I talked a little bit about maximizing cash contribution to employee accounts. Again, I'll show you a slide here in a minute. And then making dependent coverage more affordable. So we changed the way that coverage works. We moved away from just that single or family pricing structure. We have what's called age banded dependent premiums. Yes, the HR and admin people in the counties don't like it because it makes payroll a pain. But what it does is, and I'll show you a slide in a minute, is what we're trying to do is fix the problem we saw in those counties where that family coverage got so expensive that families couldn't afford it anymore. And you were losing all that good risk. So how can we bring all that good risk kind of back to the pool? And that's why we have those dependents rated the way they are. We try to be competitive with what's in the open market, so that if you're shopping for somebody that you look to the open market, here's what the cost is. You look at ours, it's set up the exact same way as they would shop on the open market, but we should be able to just beat their prices by a little bit so that it's competitive with that open market pricing. And again, we talked a little bit about that member-centric part of it. So this slide is what I wanted to show you, and again, this is a part of what Meeker County really did bring to the pool, was your generous funding of HSAs and VIVAs. So you can see the bottom part of that line before the big increase there was all the groups that are currently part of Prime Health prior to Prime Health going live, and the total balance that they had in those HSA accounts. These are employee-owned accounts, right? So an employee leaves employment with you, this money's theirs, it doesn't go back to the county, this stays with employees. And so you can see, in January 2017, there was roughly $1.4 million in there. When Prime Health started, because of the way that we funded those HSA accounts, we jumped up immediately to $2.5 million in employee accounts. And you can see the growth that we've had since we've been in operation. So there's real money now sitting that employees own in these accounts that used to disappear into insurance companies, right? People used to pay for all this insurance that they ended up not using, and the insurance company got to keep all this money. Now, we put it into these employee accounts, it stays with the employees. So it's their money to keep. When they retire, when they leave employment here, this money stays with them, it doesn't disappear into some insurance company anymore.
Question, Matt,
Yes.
is this a trend with all insurance companies in, or is this just more specific to Prime Health?
I don't think it's a trend with all, I would think that the amount of dollars is increasing, but at the rate we are, because most employers don't fund HSAs to the extent that we require as part of Prime Health. Funding those minimum deductibles on families, it's $1,400.
2,800.
I'm sorry, singles is $1,400, families is $2,800. That goes into those HSA accounts. So it's that generous funding, but any employer could do that, but a lot of them don't. They'll start an HSA and offer that plan, maybe put $500 in there, or $1,000 or something, but not to the extent we do.
And Meeker County contributes more as well. So employees.
So for family, it's 3,400 for us.
That's been a good perk for Meeker County since I've been, I mean, a lot of
Absolutely.
counties were not even doing it.
Absolutely.
But don't put in over 35 or 36, cause the IRS don't like that.
They don't,
Yeah, the IRS has certain limits.
Yeah.
of course they do.
I found it.
On singles, on families, it gets up to be 70,
Yeah, 7,200.
7,200 for families now.
Yeah.
Now you offer
Discovered
an
that
individual
rule by accident.
family policy and an individual plus one,
Yeah, so,
that option there
yep,
too?
it's, you can actually, the way that we set it up is not just single or family or just plus one, it's whoever you need to cover, you cover. So when I said age band dependent rates, we have a rate for an employee if they just wanna add one child. We have a rate for an employee if they wanna add a spouse, it'd be a different rate, it goes based off your spouse's age. If you have 2 children, there's a different rate. So you really can pick and choose and offer coverage the way that you need to cover.
So the people with 2 children aren't paying as much as the people with 6, right?
Well, so
Isn't
2
that
or
kinda
more
how
is the
it
same.
is? Is it, that's the same?
Yep, 2 or more is the same.
So if you have 1, it's different than the one with 2. Where
Correct.
it used to be family coverage was family coverage, right?
And
No
if-
matter.
And if we have a young employee, they're not paying the same rate as someone my age.
Correct. The employee's
The
rate's the same,
employees,
the
the
spouse, if they have a spouse, it varies. The employee rates are the same.
Okay,
Yes, it's the spouse, if they're gonna cover their spouse. is where
Okay.
the variation is. The next slide, just same kind of thing, this is just a different type of account, these are called VEBA accounts. So again, just showing these are employer-owned accounts, but they belong to the employee, you can't cash it out, but not as easily transferable as the HSA is. But again, there's another 2.8 million there sitting for employees. We talked a little bit about pool health, we were just talking about that family dynamic. So one of the things we watch is, are we getting more families to participate over time or fewer? Again, back to that pool health thing. So you can see when we started in January of 2018, we had about 65% of our total membership were included in family plans. Now that's up to almost 70% of our people are included in family plans. That's a sign of a healthy pool, right? We're continuing to build more and more family participation. That's what we want. That's where the good risk is. We want those kids to be coming onto our plan. Those are the people that we, typically don't spend a lot of money on, and it's good for the pool to spread that risk out. So that's one of the things we watch to make sure that the pool's staying healthy. Really, that's kind of the end of my slides right there, and so we have questions and any other questions that people have.
You started off with 8 counties,
Yeah.
and then I think I listened to like that webinar that you guys presented.
Yep.
Were you able to gain any other business?
So
Okay.
we're still hoping that this year we can. What happens is most groups don't wanna make decisions until they get later in the fall when they start thinking about insurance. So we have some other county presentations lined up here. Once we get past the summertime, we'll go out and do that. So hopefully we'll be able to encourage new counties to come in.
Cause that's one question I always have is like, if it's not growing, you started off at 8 and we're still at kind of 8, you lost one, you gained one
Yep.
kind of thing.
Yep.
Why aren't more counties, are you not seeking them? Because I think the bigger your pot, the more likely that there'd be a better rate for us in the long run. Cause the administration costs would go down somewhat and then you would have a bigger pool.
Absolutely, and so when we first started, we kind of like, let's get this thing started, this was our first 5-year stint with it. Now we've come up to that time when everybody has to renew for that next 5 years, now we're really gonna push to add more groups to it. We wanted to make sure that we kind of got through this and got through that initial 5-year period, without trying to expand a bunch of counties and really kind of make sure that our risk model was working right. Now we know it is, we have our own data too. When we went into this, all the data we had was from other carriers, so our data was as good as we had, right?
And then to piggyback off that, I understand why you did the 5 years at first, because you needed a big group amount to keep it stable. But why do you keep continuing to use 5 years as your model? Because most businesses will only look out a couple years or something like that. 5 years is a long ways out there.
Yeah.
To be hooked to one company rather than seeking options just for competitive purposes.
Yeah, so a couple things there. One is when our actuaries look at this, again, it's about that long-term rate stabilization. So if, let's just use Meeker County for example. Let's say you're gonna rejoin and it's only, we have 2-year commitments or something. So next year you end up with a few really, really high claims that cost a couple $1 million over what your total premium bill is. And yes, we have some reinsurance for that, but let's say your increase should have been to cover that cost. We need to get another 30% out of your premium next year to kind of replenish the pool for what was kind of taken out. Well, if I only have 2 years to do that, I'm gonna have to get a lot more aggressive and maybe charge you a 30% increase, when we think about the overall pool health. If I have 5 years, I know like, all right, we don't have to jump the gun here, we're gonna can stick with the regular pool trends of next year, maybe their rates are gonna come way down, or the year after that, maybe they'll come way down. So it really, the 5 years is all about stabilizing this thing long term. That's what the 5 years is for. The other reason about like the idea of like shopping and stuff, the nice thing about this is it's a political subdivision that you guys control. The county controls these. You guys have people that sit on the board. So when you think about a 5-year commitment, you're not going to Blue Cross Blue Shield. This is a company that you already own. All you've done is taken all that risk and you're sharing it with these other groups. And it's a company that you own, fully transparent. You can see exactly where the costs are going and all that stuff. So the risk of like committing to something long term when it's something you own isn't quite as scary as it is when I'm going to another company that I'm committing with. So that's why we think it's that 5-year commitment is important. It really is about that long term rate stabilization.
Is that a negotiable length of time?
It's actually, it would be the board, and the board, we discussed at the last Prime Health Board meeting, and with our actuaries' advice, the board is still saying, no, they wanna keep it 5 years. Because of what we're trying to accomplish with this thing. So, but again,
Changes,
it's something.
to go away from it, it changes your whole business model.
Correct,
Because you could end up with variable counties on variable years, meaning that you're gonna get more fluctuation in your.
When it comes to rating time, I have to be a lot more aggressive. I'm gonna have to look and see like, all right, who's leaving next year, who's in, who's not. I'm gonna have to get a lot more aggressive on rates, and that's where you end up with a lot more of those spikes like we had before. When you're in other pools, cause you guys, most of those groups, when the rates were going up and down like that, we're in other pools. They're just pools that don't have long-term commitments, they don't necessarily share risk altogether, but most of the counties have always been a part of some sort of.
But to be fair, if new counties are jumping on board, those rates, those years, the 5 years won't be consecutive with everyone else. So you're still gonna be
Absolutely, yeah.
dealing with that, it's just maybe not with the.
Yeah, but the issue is I know I have 5 years with the group, so when I look at their individual risk as a part of the pool, I still know I don't have to jump the gun, 'cause I got 5 more years to kind of recoup this.
Question on like preferred one, for example. Like you decided to partner up with them. And before I became a commissioner, I'm a farmer, self-employed, so we had health partners was ours. And whenever we went to had a whatever done, whatever procedure, whatever. If it felt like Health Partners was a little more aggressive in terms of what they were doing to the price that actually came out of our pocket versus Preferred One. This is what I've just noticed because I could see it from, I was already self-insured myself, and then looking right to this. Is there any, in terms of that, is there any dialogue with Preferred One that, hey, these other organizations are a little more aggressive for their customers' sake, that you will actually it costs us less if you go through Health Partners for particular procedures? You know, it might be going to whatever Centricare costs you $200, which is, that's insane to say that number, but for, for like Health Partners, but for Preferred One, it'd be $250. That's what I've seen, just real like from a generic sense. Is there anything dialogue that you guys have?
Yeah, so we're always working with them on their rates. One of the things we did when we first started and we were looking at all these groups too, is we compared like overall provider discounts. Like, well, how good is this company at negotiating provider rates versus this one? The Preferred One, what we found is, especially in rural areas, they were paying providers more, but they had deeper discounts in the metro areas. So some of the specialty services we actually get lower priced. So overall, the balance was there. I think it was like a plus or minus 1% when we looked at a lot of groups came in when they had Blue Cross rates before, and so we had a lot more data on Blue Cross than we did any other group. And compared that to Preferred One. Now, Preferred One did just recently get purchased by United Healthcare too. We know United's history has been they're aggressive on rates, and so we're looking to see like what is this new relationship with United bring us, and we're always looking at carving out new kind of discounted rates if we can with those payers. But to be fair, when you kind of look at it across the scope of services, they all get pretty close. They might have a better rate with Meeker Memorial than somebody else does, but when you get to like then the metro area or something, they'll have a different rate. So that variation that you see here locally is something we notice with the Preferred One network. The good part of that is kind of like to the Prime West philosophy too, is keeping some of those dollars here locally. We'd rather pay our local providers that are here more than we pay the metro-based providers that aren't part of our counties.
Thank you, Matt.
That was kind of another advantage
Appreciate
of
that.
the Preferred One network is, yep, their price was a little bit higher, but where we really saw the difference was in those rural areas where they paid a little bit better than some of the other ones.
And we also, I think, don't wanna go down where we're saying you have to drive 100 miles to get a procedure done.
Correct.
Because we're gonna pay $20 more, which is why we have HSAs and those different things in place, right? And we own a county hospital, so. I have a question about bringing the cost of healthcare down, which I don't know how we're ever gonna, that just keeps escalating. I know from being on the hospital board that Blue Cross and different ones now are really into preventative. So what are you covering for, you know, they want healthy people. The goal is to keep people healthy. So a doctor has to go through a lot of things when they meet with a patient about diabetes and different. Are we doing some things free that other insurance companies might not be doing to keep our people healthy? That's the only way that healthcare is gonna get cheaper. They want healthy people.
Yeah, I would say there's not a lot of difference right now. The preventive services that are covered are really kind of prescribed by the federal government. USPSTF, United States Preventive Services Task Force, comes out with a list of preventive services that all insurers then need to cover at 100%. What we do, where ours really varies, is when you get into that medications. So the preventive list of medications, the things that people need to, the medications that we feel like people need to stay on to stay out of the hospital, like, you know, not taking these meds can be catastrophic and cost us a lot more. That's where our plan varies a lot, is in those medications.
Can you talk a little bit about the discussion that we just had at the board meeting about wellness firms as well?
Yeah, and so the other nice thing about, again, you control this thing, is our last Prime Health board meeting is in years when we start to have good years now, and again, insurance companies typically make money. So what do we do with that? How do we reinvest that? The discussion is now moving to, let's get some presentations in here from some different wellness providers. What can we do in that preventive arena? We have some money that we can spend as Prime Health. How do we reinvest that into employee wellness programs? What do we wanna do? How do we wanna do that?
Many of our communities are building wellness centers, and Litchfield is in the talking stage of that. Do you provide, say, a discount or an option to help pay for a person to have a membership at a wellness, like America's Fitness or a local club.
Yeah, there's gym membership reimbursement, similar to what all the other plans are. You go 10 times a month, you get $20. If you have two dependents that are 18, you get $40 per family at the most.
I think the city's looking for a couple million.
Never, let's not get off this.
Yeah,
Or you can
They're
get,
I
coming.
just finished my whole Mountain Dew. No, I need that discussion.
or you can get old like me and you can be a silver sneaker and you can go for free.
There you go, there you go. But yeah,
Yes.
for years I had Blue Cross.
Yeah.
And I asked them every open season, how come you don't offer, say, $20 a month
They do, though.
toward a wellness membership? And they wouldn't, they didn't do it. And now I'm curious how you folks handle such an opportunity like
And
that.
we
We
do,
do offer it. What we're actually noticing is like the old gym membership reimbursement is actually starting to move away from. There's a lot more like online things that you can do now, especially now that United's getting in the mix with Preferred One. We're gonna go look at some of their online tools that they have for employee wellness. They're trying to build more.
I
stuff
have
like that.
some of those through this silver sneaker where you can stay home and just do it,
Right.
things.
Yeah, a lot of the fully insured are eliminating all those gym reimbursements, and we also offer the gym reimbursement, but we also offer Wellbeats for free for employees, which is like a virtual fitness program, and there's nutrition information, recipes. That's new for this year. That was new this year. But we're gonna start looking at like adding biometric screening. That was at the last board meeting. They wanted us to look into adding that, so.
That would be interesting.
Question, on the way the school system works, when people don't go in and they're more healthy, I'm assuming there's like a fund balance at Prime Health that grows in, that, like the insurance companies, they usually just pocket it. That's why insurance companies are very wealthy right now. Is that the same with Prime Health, or how does that, is there a fund balance that basically that Prime Health are sitting with? And now that, I mean, that go, if you start claims, it takes out of there, but what do you do when it gets to the point where it's at an excess, where it's like, I mean, besides these wellness programs, is there any kickbacks that are
The board can
possible?
decide whatever. If we end up saying we have $1 million extra at the end of the year and we've done the wellness things we want and we wanna buy down premiums or something next year, hey, we wanna lower everybody's premium next year, we have $1 million to do that with, the board completely controls that. You guys get to decide exactly where that money goes. Yeah, it doesn't disappear, it stays with the pool until the board decides what they want.
I mean, you always have to have some,
Yeah.
just like the county has to have a fund balance, but is there to that point where you're to that point where it feels like there's a little more that you would like?
Yeah.
Where you basically, not saying charge, but that's what happened, you charged, no claims happened, the fund balance got to the point. Do you always have at the board a collective discussion about that, saying, okay, what should we do with this, rather than sitting it in a pot?
Yes, I talked about when we first started, we got hit
We
with
didn't have,
big
yeah,
claims.
we didn't
No,
have
I
any
understand.
extra.
I think now, it's just
Now
a
they're starting
unique,
to have conversations.
it's just a unique period of time for all
I
insurance
think they have
companies.
to, I think you have to, but that's the difference, the county owns it and you're not sitting at a board on a big building down at Blue Cross Blue Shield giving the money out to your shareholders.
Right.
Because you are the shareholders, which is why we always asked Prime West to please look into this as counties, because we were spiking when we were in the co-op and nobody ever had an explanation for it, so.
I was just curious what the discussion is at this point with the board and stuff. Has this really come up too much, or is it
Well,
like, especially with us?
Andrew was,
I can say that, the discussion at this point has been to invest in these wellness programs, and
Gotcha.
that's where the focus is going right now, because, as was mentioned, we are now getting to that point where there is a sizable fund balance to be able to do something with. At some point in the future, if that fund balance continues to grow, I would imagine the discussion is gonna go into, well, how about we look at reducing premiums or reducing the increase in premiums and buying back there and putting that dollars back into the pockets of our members, so.
And
But
is
we haven't gotten to that point yet.
The wellness ideas, is that something that actually people take advantage of regularly, or is it something where it's just kind of flat plateau? You have so many people that do the gym and that's it, and it's like going,
And that was the big discussion that we had was oftentimes, the way that a lot of wellness programs work is you're capturing that population who's already gonna do it. What we wanna do is be able to identify where we have problems and be able to find solutions that address those specific issues so that we're looking at that whole health of the person. So that's where kind of the biometric screening discussion came from, and, but we need to identify what those problems are first, because they're gonna be unique for each employer. So, that's why you're looking at different companies to come in who run wellness programs to talk to us about how do they do it, what's their best practices, so that we can try and look at this from that perspective rather than just putting more money into something that only a certain population who's already taking advantage of this are gonna use.
Gotcha.
And from sitting on the Prime West board, I know that people are not going for preventive care, that it started during the pandemic. We've noticed it, same way at the hospital, and we've talked about this, when they come in, they're just really sick because they haven't. So the money is growing, but is it growing because people are utilizing and they're gonna, do you know what I'm saying?
Oh, yeah, that's why
Because
the
that's
whole
all,
thing.
that's all over the place, but I'll
universal.
also say this, I sit on a joint powers board that's self-insured, and when they keep a rate down for a certain amount of time, they give a premium vacation to their employees for a month or two, which I think would be a great idea at some point in time when there's enough, when you own something, you can make decisions to do those kind of things. That's what I think is exciting about Prime Health. So,
No, you're wrong. If we join a Blue Cross, I'm sure we'll have a seat on their board.
yeah,
won't we?
right. Or not, so, anyway.
Go back to that vacation part.
I mean, those are things that the board will decide.
Yes, correct.
But I think everybody's wondering what's gonna happen with healthcare, because everybody keeps waiting for the other shoe to drop for medical bills, and they're not happening in the hospital, unless people are real sick. So we gotta get back to some preventive care, to baby welch, things that aren't being done that really need to be done.
Encouraging more red meat consumed.
That's
Huge
important.
one.
I'm
I was
kinda
on the
off of
board,
that.
I'd be pushing that hard.
See that,
High
you
quality.
do
High
know-
quality.
You've heard about beef.
Yeah,
okay.
no. It's
All right.
Don't mean to
Anyway,
get off target.
I really appreciate this. Any more, and I'm gonna say this, I'm gonna bet that when you're looking for insurance, everybody's gonna be coming in cheap for the very reasons that we just talked about. So I hope as a board, we look to the future when we're making this consideration, because I'm pretty sure that's what's gonna happen, because they're not paying out. They're just getting a lot of money, just as Prime Health is too, acquiring some money. Prime West is. But Prime West is also searching for ways to get people back to staying healthy, because you know what's gonna happen.
Are you incorporating that into your business model, knowing that, like, for example, us, that we decided to just at least look? It's not saying we're leaving, we're just looking, trying to be prudent. Have you put that into your business model of saying, okay, we don't want to decrease this, we maybe have to, take a look at these rates, even though they're stable, maybe to take it down a notch, to hold on to some of these counties that are part of our group. And I think it was, I think Paul said that earlier on, it's like, both Paul and Beth made the same comparison, that when you go to the dance, you wanna stay with the person you went with, essentially. But we still gotta be a little prudent as a county, and I was one of the pushers of that, just to make sure, check and balances. But do you as an organization look at that portion and say, hey, okay, we are healthy in terms of this, we don't wanna lose anybody, we wanna actually have a chance to gain now that we're stabilized after 5 years, and look at those rates?
Yeah.
To be competitive to others, because in my mind, I just like to have the ability to, have let the competitive environment say, where should we be? And I don't like moving around in terms of insurance rates. We don't do that with our farm, essentially, but we will ask each year what's the rates are. We'll check them, and that kind of keeps them in check too.
Yeah.
And that's what we do.
I wish we could figure out what the rates were gonna be 5 years from now.
Yeah.
Because that's what happened before, we were up, and you never knew, you were in negotiations, you never knew what you were gonna have. And Paul would come in and say, well, they went up 10.5%, or, ridiculous amounts, and we never knew why. you'd say why, and nobody ever had an answer as
Oh,
to
it's
why.
it's a claim, it's a big expensive claim that happened.
But why was
every
it,
time.
I mean, Meeker was, and
Just
then I
bad
talked to
luck,
other
I'd imagine,
I guess,
mostly,
I
or
don't
just-
know.
It's
I
a
don't
roll of
know.
dice, and I would say, you know, to credit, I think Meeker County, when I looked through it, you guys have had some pretty good experience, just you alone have. So when you come to rates for next year, I guarantee you people are gonna come in with rates lower than what you have for
Yeah.
right now.
I agree,
You will.
they will.
But if you end up with a big claim in the next year, you're gonna get a big increase the following year.
But are you as a company looking at that same strategy saying, hey, we don't wanna lose anybody, we wanna gain people rather than go backwards?
Yes.
Are you adjusting your rates accordingly to these other companies too, especially with a healthy fund balance?
Yeah, so what we do then is it comes back to the board, when we sit down to do rates, it'll be in July. And we'll sit down and we'll say, our actuaries will come to us, the math people that sit behind the scenes will come to us and say, here's what we think you need to charge in the pool to have the budget that we have, the expected claims we have next year. Here's what the average rate increase has to be. Now, we can look at that fund balance and say, hey, we have, $500,000 sitting up here. Do we, lower these because it is that 5-year commitment time? Is that something we wanna reinvest this time around because we know other people are out there getting quotes? And that might be a question for the board, that they'll be able to decide, we'll make some recommendation, something like that, because we do know that you're not the only group that's gonna look at other rates this year. And now we're trying to keep the thing together, we wanna do that, but we also have to be realistic in what we think our expected claims cost is for the entire pool too. We can't, kind of short track ourselves and kind of go backwards either.
Because, I mean, when I look at it, the pool model is a wise model to look at. And it's just like, I still like to be prudent in terms of like checks and balances
Yeah.
too.
Yeah, I think that the point of the pool model is it's always that same thing. It's like if you're just in it for 1 year, 2 years, you're sharing a little bit of risk. This is that 5-year thing. That's the big difference. It's like over that whole 5 years, what's going to happen in the next 5 years with rate increases. Because any one group in the pool, for sure, there's years where this group could have done a lot better in the market, but this group would have been a lot worse. And those groups, just like you said, like luck. It's like the roll of the dice. Like who ended up with the big claim? You don't know where those are gonna fall, and that's why that 5 years, like over time, yep, everybody's gonna have their turn at that,
Right.
and we're sharing that, right? So you might go the first 4 years, you guys were the low group, no bad claims, and you're like, why are we part of this pool? Like this is crazy. We're doing way better off on our own. But in the 5th year, you guys had those big claims, and now you got saved from having a giant increase because of the experience you get to share with everybody else.
Kinda goes back to the all for one and one for all, and
Correct.
you wanna kinda just keep it, and it's not always easy because it just isn't.
Right.
You have to
Always
remember
group that's better.
you have to remember the history of what was going on when we started this.
Correct.
And we'll get back there again, this isn't gonna be one of those years, but we will get back.
How many companies are in the pool?
Right now, there's 8 counties plus 4 county-owned entities. So like Prime West Health, we're a county-owned entity where we participate in the pool. So my experience is through this as well.
Because we're a business, if you consider Meeker County a business, aren't we about 200 employees?
About that, yeah. But remember,
All of them.
our employees are split into 2 groups. The law enforcement group is split out and they're part of the PEEP pool, and then the remainder are part of the Prime West pool, or Prime Health pool, I apologize.
Because would it be an advantage to have people in the pool who are a larger group?
The
Do you-
pool health is large, the bigger the pool, usually the better off you are, right? Because it's all about spreading risk. So I talked about claims now, it's that luck, that roll of the dice, and they're getting really, really expensive. I said we had one member and it was, $1.5 million, $2 million in claims over an 18-month period. Well, I don't care what group you is, if that happened in Meeker County, you have to split that up amongst your employees, it's a lot of money. And so that's what affects premiums, and so that's why we gotta take those few claims, cause you're gonna get 1 or 2 of those every year. So it's about how do you spread that out amongst a bigger group of people to share that risk. That's what we're trying to do.
My question is, if this is a solid program that is consolidating rates and do it, I mean, we've talked about all the wonderful things, Matt, my question is, is the industry, the insurance industry, supportive of this model, or are you ruffling some feathers?
I would say we definitely ruffled feathers when we started. I would say the service costs look different today than they did 5 years ago. the way that they share risk, they took some of the stuff that we did. I think Peep and Prime Health came out about the same time with pulling away a lot of county groups from some of those service co-ops that used to share risk in a different way. And so they had to change their model and how they did it to be able to attract groups again. So yeah, we definitely shook up the industry a little bit with this. But we're still the only group I know that does age band dependent rates. I've never seen anyone else ever do that. Talking about trying to create a healthy pool. And then the 5-year commitment. Those are really two unique things to our pool that you will not find in other pools. But we think those are two of our keys, but that's what makes it different and better and able to stabilize rates long term.
Cause insurance is a federally mandated animal, all insurance. And it's basically what you can do and each company can do to entice its participants. That's auto insurance. There's a list of standards you have to do as an insurance company, and you basically can add some bells and whistles here and there to provide a better product or enhance the product. And just what you're describing here and consolidating them margins, if you will, and keeping them margins tight. I would assume the private industry insurance companies don't care for that.
Well, where we're different is we're a big self-funded group though, so we control how we do it.
Exactly.
Yeah.
But I mean, I'm just,
Yeah, so.
I guess what I'm saying, or my question more so is, are you seeing some pushback from, I mean, probably not, cause in a big pool, you're a small fish
Correct.
yet, but I mean.
We're not seeing anything because when we go out to, so if we go to market and we're comparing what Preferred One has to offer, and we wanna go to Blue Cross to get those same kind of administrative services, the way they look at us is just one big, large employer.
Yeah.
Like, we're one big group of, 2,700 people. They don't look at us as a bunch of individual groups. 'Cause we're bringing this whole
And I'm looking more on the political, has the state or anybody else?
The Department of Commerce really liked this model when we went through it. They helped us a lot to get it up and running because they see it as an advantage for
Okay.
counties to be able to share risk, come together and share risk.
That's where I was going. I
Yeah.
just wanna know what kind of oppositions or hurdles get thrown at you
Yeah. So far,
sometimes.
the most.
Sometimes when things work too well.
Yeah.
Then they gotta fix
You know, I
them.
mean, now,
County-based purchasing.
yeah, that's where I'm, exactly where.
One thing to look at with that is what this group has done is basically modeled what a very large employer would do, right? A large county like, I assume, Hennepin County is a self-insured county where they do the same thing. They have a company who provides the administrative services. What this group has done is they've just taken a lot of smaller counties and put them together as one large employer.
The true definition of a co-op from here, that's what farmers did
That's right.
50 years ago, 70 years ago now, in the 50s, is start forming co-ops for collective bargaining. So same
Correct. And then we
basic
just-
principle.
We just did that kind of all for one, one for all principle that goes through this one where, a lot of the pools or whatever will say, all right, if you had that really bad claim, we're not gonna share that equally with you. You're gonna get a bigger increase
Yeah.
than everybody else is. But this is, the county's agreed right from early on, we wanted it, this is all for one, one for all. We know we're all gonna have our turn with a bad year, so, and a good year.
I have just one more question. It's basically on why you're not growing portion. Like, did you do these webinars like last year in terms of that? Or, because when I look at some of this, I'm like, when we first did this or whatever, I talked to even Meeker Memorial, I'm like going, they're pretty smart people there. Why didn't they buy into this? And I'm thinking, why are these other organizations not buying into this either? Because I'm thinking, well, is there some drawback that they see? What's your biggest obstacle of actually growing the group? Is it the 5-year commitment? And don't you think sometimes maybe that's something that as a group that maybe, I mean, these are smart individuals out there too. Maybe there's some say to that, because I'd want a group, an organization that would continue want to grow. Because like I said, I starting to understand and I believe in the pool system. The part where I sometimes have hesitancy is that you haven't grown. And what are the is that the main drawback then?
The big one has been the 5-year commitment, and we haven't been out there pushing it, like I said, this was our first 5-year chunk. And we really wanted to build our own data, we didn't wanna, after year one, really push and expand a bunch, and then we had bad experience too, so we dealt with that. Making sure like, alright, does the model work, and now we know that it works, so we are gonna work harder this year and next year to expand the pool than we ever have before. I mean, that's part of Lee and I's task, is to really go out there and talk to these new counties. Plus, Prime West Health is expanding counties too, we've added those 11 new counties. And there was always this weird timing thing with them too, were they a part of the county who's purchasing, were they a part of Prime Health first? Cause this also, one mistake we probably made was naming it Prime Health, and made it really confusing when you get into the counties.
You hear enough from the committee updates, I'm like, sometimes I gloss over, I was like, what are they talking about,
Yeah.
Health or West? Like,
And so that's what we wanted to try and keep that clear too, like what's happening with these expansion counties, they wanna get a county who's purchasing first before we really push this whole Prime Health issue to them too, so. To try and keep those two separate.
Okay, we're gonna have to move along.
Yeah, I just wanted to say, we are going through our procurement process, and we'll be coming back in the next couple of months to have further discussions with you about our next steps forward through that, so, just to kind of wrap.
Any other questions before? Thank you very much
You're welcome.
for coming out.
If you do think of anything else, I mean, Beth, Paul, they have our contact, just let them know and we'll
Absolutely.
answer any questions too. So thank you guys all for your time.
Thank you.
appreciate your
Thanks, Matt.
presentation.
Yeah.
Drive careful.
Where am I going? For a pickle?
Bucky's Bar. Oh,
El Rosa.
Get the Bucky Burger, don't pass the pickles.
they make a horseradish hamburger.
Oh, man. I'm
Bucky
not
Burger
hungry.
rocks.
Quit it.
What's that?
The Bucky Burger.
It's just a.
You've had it?
They pulled up.
I used to have an office.
There ain't much
Pickles,
in
a
it.
lot of
There is
cooking.
not much in El
God,
Rosa.
yes, I took a picture.
Buckets.
I tell you,
Those are the best
those
pickles.
pickles that they
Oh,
have
wow.
at, what do you call it,
Toss up
like
between
canals
those
too,
and
those
those ones
horseradish
and
pickles,
These are
whatever, I don't know what you do.
Really crispy.
I know, I like those too.
Oh,
I mean, you can only eat so many,
Yeah,
and don't
yeah.
expect your spouse to kiss you afterwards.
no, I don't have a spouse. so-
Yeah, I know, so then you can eat as many as you want,
As I
so.
want.
What's this thing about Beth and I going to the dance too? What was that all
Oh,
about?
yeah.
That's
I was gonna ask you, what,
It was
Well,
not-
how often
I was
do you go to the
paraphrasing.
No
dance?
drinking.
That's what I was.
I gotta watch my
I wondered-
wording these days.
Are we gonna do this before we close?
Yes, yeah,
Looks
let's
like
do
we are.
Phil's and
That
then,
isn't time,
yeah,
I'm thinking of a public hearing, I guess.
just a PDF. so.
Oh, I sent in a, did you have the PowerPoint? Well, good morning.
Morning.
Here to go through our annual report. Sounds like you guys took care of a couple things without me earlier, so you barely even need me today. I guess a couple of highlights from our 2021 year end. Our dollars in pretty much equaled our dollars out. About $8.7 million ran through our highway accounts. In the end, we were about $11,000 in the black, so pretty even keel year in 2021. And for reference, about 2 of that 8.7 million is levy dollars. The rest is primarily state funds and then some federal dollars too. There we go. So some highlights, major construction from 2021. Not on fire.
Somebody is.
Is it plastic burn?
Is it your,
Plastic or electric?
is it your cup?
No.
Well, they say if you're having a stroke, you're gonna smell burned toast. I hope nobody smells
That's,
burnt
that's
toast
what,
right
that's plastic.
We're all
Something is,
having the same.
Yeah, we're going down.
I have a little fan down here and I turned it off.
Okay.
you really do?
Yep. I have a little
No,
fan.
no, she doesn't.
Gosh, now I didn't smell
I
it.
turned it off.
I was about ready to
Pregnancy
evacuate
nose.
the room.
It's getting lighter.
If Phil's got some water, we can just throw that on
Hey.
the fan.
All right then, Julie, you're
Yeah,
just
if it's
full of
electrical, I
surprises.
can handle this.
Yeah, he's fast.
Okay, anyway, 3 major projects, part of 2021 construction, and I'll talk about those a little bit. So CASA 6 reconstruction, that was rebuilt in 2020, we paved it in 2021. Here's just an image to show about where that is. That's the city of Dassel you see in the upper left. Red is the road that we rebuilt. 2.5 miles long, rebuilt. We added shoulders in 2020 and then we paved it in 2021. paving costs were just under $1 million for that 2.5 miles. Grand totals on the project, it was about a $2.8 million project. $1.7 million was federal, and the rest was state aid funds, state money. Just a picture of what the road looked like before the project. You can see the narrower shoulders. It's hard to tell here, but the inslopes are a little bit steeper. And then an after image, a little different angle, but same location actually of the picture. But wider shoulders, new pavement, that's really what you're looking at. And there happens to be new poles there. Excel did a transmission line replacement, kind of in coordination in conjunction with our project.
We don't pave the shoulders. Why did I think we did?
Pay for what?
We don't pave the shoulders of the road?
No, like on this one, we went from a 24-foot wide pavement to a 28-foot wide pavement, so there's a little more pavement outside that white line,
Oh,
but there's still a 6-inch gravel, or 6-foot gravel shoulder outside of that. Paving shoulders, you know, in the right situation, especially near a city, we might explore that, but the cost of installation and maintenance is generally not worth the expense.
so, okay.
Question on that, Phil, is like when you do widen the road like that, do you have to pay the farmers on each side for the additional right of way then?
Yep, like on this project, we had 33 feet from center line on each side of the road. We purchased up to 50, so an additional 17 feet along the entire road, in addition to some temporary easements that we bought. Because the actual construction typically uses more than that 100-foot corridor.
And the farmers were just put their fields out that much further? That's the part I just can't imagine happening.
They get paid. We
Right.
purchase the rights. Yeah, and there's a lot of discussion that goes on trying to purchase that right away.
Gotcha.
Then they weave in and out.
Yeah, exactly, right next to the poles, I'm like, depending on who's doing that plowing.
In your experience, Phil, Meeker County has been very generous with their citizens giving up road right away for
Yes.
the payment amount. That's not necessarily what you saw in McLeod County,
Yep,
so.
the citizens in Meeker County seem very easy to work with as far as trying to get road projects done when it comes to widening. It's been pleasant compared to past experience.
We've had a few cases where it wasn't, but those are rare, fortunately.
I would agree.
Tough county attorney, I imagine.
A friendly engineer.
Second part of that area, so in conjunction with that paving, we also did an overlay on the north-south piece you see on the right-hand side of that red line. South of the red line was the reconstruction project. This red line was just a half-mile long overlay going into the south end of the city of Dassel. Thought we'd clean it up, improve the pavement while we were in the area with the contractor. It's a short project, half a mile, relatively inexpensive contract, $123,000. Used municipal state aid funds to pay for it. I don't know if I've mentioned this in the past, but our state aid funds are split into municipal and regular. Regular is basically rural dollars, but they're targeted for us to spend a certain amount of our dollars in municipalities. And one other thing we gained with this project is a widened pavement surface. So we went from 24 to 28-foot pavement. We notch out a little bit of the gravel shoulder and then widen the surface. That helps us with our shoulder maintenance. That's the primary reason that we do that. Our biggest contract of 2021 was an overlay on CASA 1. That road, 15 and a half miles long, so a pretty lengthy project. Same concept as what I said of the 6 overlay. We notched out 2 feet of gravel on each side of the existing pavement, paved in a wedge, and put an 1.5-inch overlay over the top. This road had a lot of ride issues when I started. It's the only, one of 2 roads that I've received a number of calls on in my time here about how rough the road is, and it wasn't that old. So I think an overlay was a good solution there. The ride is significantly improved. But if you drive the road,
Significantly.
yeah, it's a lot better ride, but if you drive the road, keep in mind, an overlay, the reflective cracks come right through. So if people mention cracks, or if you see cracks, those will exist year 1 on an overlay. That project was about $2.3 million again.
How big
state aid.
overlay are you doing on it? How big a overlay?
On this one?
Yeah, or,
So 1.5 inch final wear, but we also put down what we call a tight blade. It's typically about 3/4 of an inch in thickness, but it varies to fill in some of the deficiencies that we have. So it's kind of like a 2-lift pavement. I call it 1.5 inch, but you're probably more 2.5 by the time you're done.
is that do you know what State Highway 22 north, they widened it 2 feet, left the fog line in the same spot,
Mhm.
you know, to keep the lanes narrow. But they're actually doing a lot of patch. That was 3 Julys ago, I think. And they're doing a lot of patching. They just had a temporary signal out there right next to Forstman Farms yesterday. Is that, so that was just a thin overlay too?
Yeah, they used ultra thin bonded wear course, if I remember right, without a leveling course, so that's a different type of material.
That was like an experimental.
It's, I'd say it's not experimental anymore. It's a good product, but it's a different product. It's much thinner, lower cost. It's like a chip seal that you put into a mix plant, if you wanna talk about it that way. It's just oil and chips mixed together, put down with the paper. Very flexible, but you don't get a lot of structure out of it. So,
And that one shows immediate, I mean, there's a lot of bad,
And I think-
that's a tough rule.
I think there's still old concrete under that, if I
Yeah.
remember right.
Yeah.
It's still gonna drive the movement of the road as long as those panels exist.
The width was the best part, you know, adding the 2 feet of it.
Yep.
That was-
Yeah, anytime you have gravel shoulders, the washout of the edge of the pavement from mainly semi-traffic is battling as far as shoulder maintenance. So when you widen the pavement, you really help with that.
When you have a very rough road like that, that's new, is it underneath is the problem, or why is it usually rough, or do you have to excavate that portion, or is it by swamp or something, or what,
It
or what's?
depends on the road. On this one, I think a lot of it was, if I remember right, half of this road back when it was reconstructed in the early 2000s was paved the same year that it was graded. So all the earth was moved and pavement was put over the top in the same year. So that section just had a lot of undulations, waves. Culvert crossings were bad, pretty significant dips at culverts.
I got you.
So just the settlements hadn't gotten worked out before that pavement went down. But I know culvert crossings were pretty severe on that whole segment, even the section that was paved and graded in 273.
And that's when you decide an overlay would be the best route, because they just didn't have the timing right down as far as let it sit, settle, then pave it. And that's why you decide the overlay rather than excavate anything.
Yeah,
Is that-
yeah, if we
Gotcha.
were gonna peel up, if we were gonna excavate, we would have to peel up all of the existing pavement and basically start from scratch. That's when, for rough numbers, I used to say $1 million a mile for, if you're gonna move anything under the pavement. That's probably not enough anymore. This overlay was closer, I don't have it broken out here, but I think we were under $200,000 a mile
Yeah,
versus $1 million. So if we can avoid moving what's under the pavement, we do that,
gotcha.
unless we have to go there. Just a picture of what it looked when it was done. Again, you'll notice the wider pavement outside the fog line. You can already see a couple of cracks showing through. That'll be chip sealed this coming.
So if you grind up, widen the road and resurface, that's $1 million a mile, or?
If we don't touch what's under the road, I'd say 350.
Okay,
350 to 4 if we're doing a reclaim project.
reclaim, that's the word.
Like the ones we have scheduled this year on 3 segments, 28, 23, and 21. And that will do if the pavement distress is severe.
Is that widening too, putting wider
Yes.
shoulders on?
Yep, we'll grind up, those are 24 feet wide, and we'll grind them up and put back 28.
Yep.
Where we have the space to do so, that's our primary goal with our construction, is to add that 2 feet of asphalt.
Is that Casad 3 up there, is that a?
2025. Yep, that'll be a reclaim project.
Are you gonna widen the top too?
Widen the pavement a little bit, but we're not gonna widen outside the PI, so where the outside of the shoulder is now is gonna be the same when we're done.
So when you're talking about costs, you're talking about new costs, or, I mean, it's gonna get higher, right, as we move
Yeah.
along?
That's why, I used to use $1 million a mile for a grading,
Right,
300,000 for a reclaim, and 100,000 for overlays. That's changing pretty quick. So, I mean, if I was gonna do gas, I'd say 1.25 to grade, 400 to reclaim, and 175 or 200 to overlay.
yeah.
Don't quote me on those.
Oh,
I thought you just did.
Well, we just approved that fuel, so
Yeah.
that's the percentage of that
Yeah,
tied into the project,
only twice.
oil.
Other project that was notable last year, we did a highway safety improvement project. It's a federally funded safety project where FHWA pays 90%, we kick in 10% of the project costs. Installed intersection lighting at 15 locations around the county. Kind of tough to see, but it's a little yellow dots. I think I had one phone call from the public who thought it was nice. Mainly our guys really like it for cleaning up snow and ice in the dark.
Okay.
I got a couple emails, I'm sorry.
Couple of compliments to it.
That were well, that one person has been working on that out by the.
Yep.
She's like, I knew you'd get it eventually. Finally did something right, you know?
And there may be more of this, we'll see. I'm targeting now, right now, we didn't do any trunk highway and state aid intersections with this project, because we had some agreements we had to work through with MinDOT. That would probably be phase 2, but that's not, hasn't been applied for or really pursued too deeply yet. Just a picture of what went in the ground, so that's what the base holding up those light poles looks like. It was a precast base that we used on this project. Drill a hole, drop it in. There's a completed light. We chose to put one light at each intersection. I know MinDOT will do 2 to 4. One, I think, adds a lot of value.
I've got one just up the road from us. That is so great on that T intersection, and it really, you can see that from a good distance away.
But
Yeah,
how
and
many
it's
years
one
do
light.
they last, like forever? I mean,
Yes.
is there maintenance on them?
Bulbs typically, but we put in LEDs with this installation, so I don't expect to be replacing bulbs anytime soon. I know when we used high pressure sodium bulbs, in a project I did in McLeod, at year 3 or 4, some would already be burning out.
Yeah, LEDs are the answer nowadays.
They didn't produce near the lumens of light that these LEDs are, did they?
They're comparable.
Are they?
You could size them accordingly to have an equivalent LED bulb that, or an LED bulb that's equivalent to a high pressure sodium. Usually it's 250 or 400 watt. So these are equivalent to, it's 250 or 400. I don't remember which one we went with.
As high pressure sodium starts to die, it actually just dims. And so you're not getting the same lumens, but the light's still turning on. It's not like an incandescent bulb in your house where it just goes out. So that's often where you see that, whereas the LEDs, they don't do that.
Are these powered by electricity or by solar?
Electricity. So we had to work with our local power providers. It was mostly Meeker Co-op to get power to all these locations as part of the project. And then we do incur a monthly fee for these installations. I think it's $35 per light.
Well, I think it was a great project, and I'm glad you got it done. I compliment you. Really do.
I was happy with it.
It was talked about for a few years, even before you came here, so.
You even promised somebody you were gonna get it done, didn't you?
And it's done. There you go.
So a brief summary of our 2021 construction costs. It was about a $4.3 million program last year. The vast majority was state aid funds, that's gas tax registration, that kind of thing. About $800,000 in federal money, and then $34,000 stuck out there as far as township bridge funds, which again is state transportation money, just goes in a different pot for our township bridge system. That was finishing up an old 2020 project. Engineering associated with that program was about $265,000 on the year. So summary of maintenance, how that looked in 2021, it was about a $1.8 million program on our state aids. I broke out the biggest numbers there, so you can see that the biggest one is kind of the everything else, the $560,000 for culverts, gravel, blading, and other, but snow and ice is significant. Pavement surface repairs, that's a big one. Chip seal is always a big contract. Township maintenance, you can see that's almost 50% of what we spend on maintenance is in on our township maintenance program. A lot more miles, but less service per mile is how I describe it. $750,000 are spent blading gravel roads, and $300,000 are spent by our department snow and ice removal in the township system. And then the brush and weed control, that's mowing. So that's not spraying for the townships, that's how we classify our mowing operations.
You wanna ask them about spraying that we just talked about earlier? In the report, are the townships, we only had one bid on that spray contract. I know it from when I was on the town board, it's not easy to get people, cause you go after the co-ops and they're busy spraying other things this time of year. Is, are some of the, townships using the same contractor, do you know of, or got any?
This year, I don't know. I know none were part of our quote. We asked and none of them jumped on board. I know Cosmos, it might have been Cosmos Township, wanted to jump in on ours, but they had some non-township dollars they wanted to use for spraying and it didn't work with our timeline. But that was the only township that we were working with, but they went on their own.
I think that's been an issue with a lot of the townships, has been the timing, because you can't control when they're coming to spray, and
Yeah,
then they get.
They wanna spray and you already, like, parsnip, wild
Right.
parsnip and that stuff, it's too far gone. Yeah, spray it now, and
Yep.
it's the competition, they got too much work to do, they can't get there in the same window, that was always the issue.
I was shocked at the price increase from last year.
Yeah.
More than doubled.
Fasten your seatbelt.
And
Yeah.
it
It's
was,
the beginning.
Yeah.
per mile, it didn't quite more than double because we're doing more miles this year too.
Yeah.
But it was a significant increase. When I see prices like that, things we think about is we could look at spraying internally, but the investment in equipment, training, at this point, not worth it,
Licensing.
but it's something we think about. In the past, we used to basically solicit quotes. We would email or call vendors. I don't like doing that because you're kind of playing favorites if you leave somebody out. So the past couple of years, we've been advertising the same way we do any contract to give everyone access to it. If we continue to see only one or no quotes in the future, maybe we have to do a combination where we advertise and call people to say, hey, give us a number. I just don't want to be accused of playing favorites. That's why
I
we
just
try
think
not
you're
to do
not
that.
gonna find that, I mean, it's been getting less over the years because of some special licensing that went in, I know some local people that, but because of some things like that, so. I have a question on that township maintenance.
Sure.
So that's our cost for the township maintenance?
Correct. And I'll get into what the township
Okay,
paid
that's what I wondered.
next slide.
Yeah.
So the very top figure, 440, the snow and ice removal. We've kind of had an easy last couple of winters. Is that relatively?
2019 was bad. 2020 and 21 have not been too bad. I would say
This year was
Normal.
deceiving though,
Yeah,
the wind.
because I plow snow for the church and there was a lot of trips. I mean,
Yeah.
you did a lot, I mean, there wasn't a lot of snow events, or big snow events, but a lot of maintenance, just a lot of maintenance.
When it comes to snow and ice, the wind hurts us more than the actual accumulation, I think. This past spring, or whatever you wanna call it, January, February, March, was especially bad. We didn't get a lot of snowfall, but it blew around every single day. And when it blows, it drifts, and we're out there chasing it.
Okay.
Heading is wrong. This is 2021 highway maintenance receipts. So the big numbers you see there, that's the same as the previous slide. Maintenance costs for county and township, 1.84 and 1.65 million. Below each one, I just broke out the funds we use to cover those costs. So our state aid, we used 1.73 million of our state aid dollars for maintenance and $164,000 of CRISA funding. I don't remember what that acronym stands for. That was federal COVID funds dedicated for transportation use. Township maintenance costs, that's where you'll see the township maintenance fees added up to about $500,000. About $50,000 was billable work in 2021. The remainder of that cost is covered through the county levy per our agreement. And 30% has historically been about where the split falls between the townships and the county as far as who pays what on the township maintenance program. In 2021, we ended up at 29%.
and are we raising that annually, the maintenance fee now?
I
To cover
believe
these employees and all this,
I fixed it for 2022. I'd have to look. 2023, it either goes up from $700 to $800 or it's one more year fixed. But it was fixed for a number of years and then it increases, I think, $100 a year for the next
we got
3.
it set in there, and we're doing, how many townships right now?
15.
So we have 2 that are independent now?
Yep. Dassel and Collinwood are hiring their own contractors.
we doing with the dead ends? Any more complaints, issues? Don't bring it up.
They're still there.
Oh.
You know, Kingston Township has actually been pretty proactive with trying to make some improvements on their dead ends, which we're all grateful for, I think. Other than that, not a lot of new news to report on them.
I think Darwin Township has taken on
Number
some.
4, look at you.
I don't know if they've been, we've got 3 they've been talking.
Building the power.
They told me
Touch my dead
they
end.
were willing to do them.
Yep.
Except for the
They
county
mentioned
attorneys.
At the meeting I was at a year and a half ago.
Yeah,
It's always
but they're
hard.
not, so
Never
maybe
there.
they
Something else.
might need to,
Yeah.
if you want them to do.
At the ice castle.
To answer the question about the fees, 2023 goes up to $800 per mile, and then it's $50 a mile each year through 2025. So $850
So
and then
23, it goes to what?
800 from 700. So it's a $100 increase
Next year.
next year in 23. Yep, 22 we kept it stable because we hadn't executed the new contract yet.
Is that all? Yeah, when's the is it 2 year, how are contract? Every
It's
couple
perpetual,
Oh,
so
every-
I'll give them the new fee 3 years in advance of
That's what I thought.
the date that fee goes into effect, but it's perpetual until either side chooses to sever the contract. And the reason we didn't up the rate for the first 2 years, I guess it would be, is so they could budget it. That's one thing we heard from the townships consistently, is they wanna be able to budget the number, whatever it is.
But they're not unhappy with the number.
They're what?
They're okay with the numbers though, right, the raises?
Well, I haven't heard anything
Well,
about
I
the
mean,
fee, I guess.
that's what I heard when we hired these people, that one of these employees was gonna be covered by the township payments. So
No, they're aware of that, yeah. They,
Yeah. I just wanna make sure.
What does it cost to take a mile of gravel road and tar it?
$500,000,
Yeah.
we estimate, if you weren't gonna widen it, if you were just gonna prep the gravel, add a little bit of gravel and put down new asphalt, I'd say $500,000 would be my.
You're gonna do a mile in front of your place?
Well, you know, you can go and talk to the township. $500,000.
Pavement's expensive, and that's just the upfront cost, then you gotta talk about all the maintenance that goes on after it's installed.
haven't been out of Watkins to the north, but there was locate flags and stuff there. Did that get, our speed sign, did that get put in?
Oh, yeah, that's.
Did it? Cool. I just haven't been by
I
a
haven't
couple
never see
weeks.
it yet, but,
Me either. I'll have to, now I gotta make a special
it's
trip.
there, you can test it out.
Both ways.
We'll send Danny through it.
Yeah.
So,
No, I need a message, my guy.
Madam Chair, if we're through with questions, I would suggest we take a short break before we go into closed session.
No, I think we're gonna move right on, I'm getting a headache. No,
No.
I'll do a short break.
That's quite a presentation, Phil. You gave her a headache. Goodness sakes. I thought it was good, but I
Township
don't know.
maintenance.
Yeah.
That's why I was going last.
Does anybody have any questions? I didn't mean to cut anybody.
No.
No.
Well, we'll be 5-minute break and then we'll go into closed session.
Thanks, Phil.
Hey, Steve.
All right, 5 minutes.
Look who's here.
Did you find the gavel, or you just gonna
I-
use my head?
I have a chair.
Do I wanna sit in front of you with
Oh, you were taking your chances.
Andrew, we don't need a motion to approve the annual report or not?
Just information.
We
We
need
need a motion to go to closed session.
We do need a motion to go to closed session. So we're really looking for a motion to go to closed session pursuant to Minnesota statute 13D 05 subdivision 3B for attorney-client privilege to discuss potential litigation with Minnesota Department of Human Services.
Motion to what he just said.
Motion
Second to
by
that
Commissioner
motion.
Schmidt and second by Commissioner Schiefelbein. So we are now in closed session.
We need a vote.
Oh, I'm very sorry. All in favor of going into closed session?
Aye.
Aye.
Opposed? We are now in closed session.
All right, let me just,
Stop the stream and.
stop this. I'm going to,
On a side note, Paul,
Beth, you ready?
Grove City Care got their DHS grant.
Okay, are we ready?
We're gonna get
So
together as
I would look for a motion.
Move to request mediation with the Department of Human Services regarding the selection of Minnesota Senior Health Options and Minnesota Senior Care Plus.
Do I hear a second?
I'll second that.
Motion by Commissioner Johnson, second by Commissioner Bredesen. Any more discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you, Paul.
for your time.
All right, moving along, Andrew, County Administrator, Administrator's Report.
Just really brief, wanted to remind you that on Monday, the AMC district meeting will be taking place in Buffalo at the Wright County Government Center, 8 a.m. to noon. Lunch is included with that, so if you're interested
Who's
in
going to that?
going to that,
I think I am.
I'm
I
planning
am.
to go.
Did we have to register? I think.
You don't have to register.
Okay,
I didn't see
good.
that.
I don't think I did.
Can
but
I
had it
call
on
you
my
if I
calendar.
decide to go?
Yeah.
I gotta see what my schedule
Yeah,
is.
there's a place along the way that, where I know we can get.
Another pickle joint.
Bucky's Bar in Buffalo.
You guys might be asked.
There's a ring to it.
Long as there's a
Did you wanna just talk about the daycare task force meeting you went to, cause I wasn't there?
Sure, I'd be happy to do that. So on the AMC thing, real quick, one other note though, in the fall, I don't have the date for it yet, but the meeting is in Meeker County.
Oh, fun.
So I think it would be great if we all could be there for that.
That's the
meeting, since
second
it's
one, I think, since I've been commissioner that we've ever had.
What venue are you thinking?
I don't know. I learned it was gonna be in Meeker County when it was on the agenda, so.
We had it
haven't talked-
downstairs in the big room last
Yeah, I
time.
imagine
And
that's
then we just
probably what
catered some lunch,
Okay.
so, yeah.
Speaking of the childcare meeting, the last meeting was held on May 25th. The big discussion was First Children's Finance had a grant, federal money that they were offering. It was a really short turnaround to be able to submit the application. They were looking for grants up to $30,000. However, then you'd have to provide a 50% match, so you'd have $45,000 towards the project. Any grants up to $15,000 did not require a match. So the plan was to keep the ask at that $15,000 figure. The plan was to focus the grant on, all the grants had to be focused on new and existing providers that provide more capacity, so more slots. So whether it is facility construction projects, certain types of construction were eligible, certain types were not. Training was the other thing. So those were the two things that we're gonna be focused on, was that construction piece, those dollars, and then training for providers so that you could have someone who's currently an aide potentially become a teacher, and now that person can, watch more kids. The big problem still, of course, is the fact that there's not enough people to be able to work in these facilities. For example, Stay and Play, which is the center here in town, they have sections of their facility that they could expand and have more slots in. They just don't have the staff to be able to reliably provide those slots. So that's the update on the childcare team. Any
Yeah,
questions?
and I am starting to hear stories now about people that were gonna take jobs in town at places and have had to stay home because they absolutely can't find daycare.
We had an employee who,
The county
we
did.
had,
think
was
the
getting ready to
hospital did
start
too.
and they had to quit because they couldn't find childcare.
The
Their
chamber
childcare
is
dropped-
getting
fell through.
calls saying, please help, and there's no, so it's becoming a more severe problem today than it was a year ago. It's just,
very serious.
I don't imagine, like, a lot of, I shouldn't say a lot, but certain businesses have open child care within the business or for their employees and stuff. I got an eyebrow out of Brandy.
Yeah.
You get
Is
used to
that,
that
I mean,
anyway.
you still gotta have somebody staff it, so. I
You still have
mean,
to have somebody
it's
staff it.
Still the,
And
I was just curious if that.
That's
model-
why it
so
wouldn't.
we've had several conversations with businesses about this, and one of the challenges is certain businesses see it as a problem and others don't. That community fund that was established, you know, the EDA put $10,000 into it. I know at least one other business put some money into it. I don't remember exactly how much it was, but you know, as you know, Judy Holstrom was reaching out to businesses, she was getting comments back from folks of, well, they're a business. Why do I need to give my business's dollars to subsidize another business? So there's kind of a lack of recognition of the kind of the negative economics of running childcare, where you need to pay your employees a certain amount to have employees, but to really be able to pay them what you need to, you have to charge this amount, and at this cost, parents don't bring their kids anymore, and now you don't have that revenue stream anymore. So that's the challenge that is coming through all of this. And then, you know, we have that. So of course, it's the availability of workers, it's that recognition, and then also employers are not always seeing that it's a problem for them. So, because you don't see the applicants who you don't get, right? We don't know who isn't applying for the openings that we have in the community because they just don't have childcare. You know, if I don't have childcare, I'm not even gonna think to apply for a job because what's the point, right? I'm gonna waste everyone's time of showing up to this interview and going through this whole process. So we don't really know. We know that there's a significant challenge through the surveys that we've completed, but we don't know exactly how many of these positions could potentially be filled in a quick turnaround if we had more childcare.
Right, did you have anything else?
Yes, June 14th, 6:30 PM, we are having the Board of Appeal and Equalization that night. We only have one appointment. You received a packet yesterday from Missy in your email. And then as an FYI, June
16th?
14th?
14th, 6:30 PM. And then as an FYI, June 17th and 20th, it's Friday and Monday, I'm gonna be on vacation up in Duluth, doing a little run that
Good for
weekend,
you.
so. That's it.
Steve, do you wanna go next?
Oh, yeah.
You don't?
Oh, one thing, is that true that we closed on the property then?
Yes, we did close on
That's
the
on my
property.
report.
Oh, I wanted to
Steal
steal
my
it.
thunder.
I was just gonna
Gosh
say,
darn
a
it.
silver-haired
He needed
little
some-
birdie told me.
He needed something for his report.
I know, I don't have much.
Hardly had anything. and
Ah, darn it.
I will tell about that.
Okay.
Well, then I will say, maybe.
Touche.
Okay, Steve, do you wanna go next?
Grove City Care, I've had a couple meetings with them. We did find out this week that they did receive their biannual, DHS grant that helps, that's a big portion of their funding. So they did receive $50,000 for that, so that's a huge relief. That program operates heavily on grants and donated dollars and things like that. We also did have a meeting. I met with Donna Whitcomb and Paul Bukovich with Grove City Care, and we were looking at trying to bring some funding streams that can be run through social service. A lot of the work they're doing is reimbursable, but they're not lined up to do it. So Paul is trying, that's something I had Paul there a couple of years ago when I first started with Grove City Care, probably 3 years ago now. And, looking at a way to make the program more sustainable long-term, because you have one, Andrea Dahlman writes a ton of grants for them, and if something happened to Andrea, that program is no longer in existence. So we're looking at a way to get them some reimbursements through social services. And we're finally sitting down, getting some of those things together so we can put that in Paul's budget for this year, cause there will be some costs incurred with that process, but we believe it'll work its way out in the long run. Other than that, drug task force, I had a Zoom with that here a couple weeks ago. It always amazes me how naive I am in the world of drugs in the world and what gets taken off the streets locally here within a couple counties. Brandy could elaborate a lot more, but I'm sure she can't. some of it, but, there's just a lot more drugs out there. Meth is still the primary concern, and they really do a good job. It's, how many counties, it's kinda in the task force, and it
It's
just
called the C6, but there's only 5.
good enough.
That makes perfect sense.
My math doesn't work like that, but anyway. No, they do a very good job. I mean, for the region they cover and the amount of people involved there, it's impressive. And them are the main things that I had work session. That was on facility planning and stuff, and we were all there, so. That is,
Bye-bye.
Yeah, I had one committee, is one watershed, one plan for North Fork. Just talked about allocations in terms of how it was, how money was going out and the discussion about how to incorporate more landowners into buying into different programs and stuff was kind of the gist of it, what avenues to seek, I suggested maybe going through the co-ops in terms of that, or the farmers who use them as their, to do some of the soil testing and stuff, that many times landowners will want to see what the benefits are, the cost analysis of it to being part of a program, It's something when I think you're on another, just in the embryonic stages of the one watershed, one
Very
plan.
embryonic, yeah.
Yeah, that down the line, it might be a helpful hint to just say, how do you get the landowners to invest into these ideas or not? And it's always a cost analysis that goes into that,
One of the things, how do you advertise that you're working on a project aside from a direct letter to every landowner?
Yeah, I'm not sure exactly how they did that, because this one was established with Hausman
Okay,
long time ago. I don't know how they did that, but I think other one watershed, one plans would have that kind of,
something, yeah.
because I'm sure the same county people work.
Yeah, we shouldn't have to reinvent the wheel. It's gotta be.
I wouldn't think so, but it's not always the case if you go to other plans. I'm sure Brandy can tell you about that if you wanted to be dulled. But or if you need a good night's sleep, you can talk to her about that. Besides that, the only other thing I would like to bring up is I'm sure you all got the letters from the Woodland Centers and about my committee update on May 3rd. I wrote a letter replying to them. I think I said enough in terms of that, and that's my response, but I wanted to at least bring it up in the public meeting that they did send out some letters to the executive board, and then the executive board decided to send it to all of you. And I decided I thought I should send a letter back defending my words and also apologizing for any inaccuracies I did say, because I shoot from the hip when I talk, and I'm more an informal speaker. And that's all I got.
Commissioner Johnson?
Oh, scooting all the way down here.
Oh, wait,
huh?
do you wanna go next, Julie?
Doesn't matter.
She had her.
Go ahead.
She had the glasses in her hand.
I'm ready.
Okay, Julie, go for it.
Okay, well, back on the 17th, during our regular commissioner meeting, we attended the 9 o'clock peace officer memorial service. I just wanted to admit, that was very nice. Well done. This year, the weather cooperated. Last year, we all had to move inside, but it was, the one day it rained last year was on that particular event, but that was very nicely done. We were all able to attend. Then on that same day, I attended a personnel committee meeting. That was on Tuesday the 17th. And then on the next day, May 18th, we had our local public health committee meeting. Dr. Searle has been our chair, and he's been our representative from the medical team. He has retired, and he has a replacement person, and that person will be now invited to our next meeting, which is coming up in July. So we'll get to meet Dr. Searle's replacement. We're looking for another community member. We're looking for a couple, actually, to help serve on the local public health committee. A K-12 interested person would be a nice addition. But if you know of anyone who would be willing to represent your district, either contact myself or Diane, and we will encourage that person to join us on the Public Health Committee. We had a very nice presentation on child and teen checkups, dental health programs that are available here in Meeker County. Talked about the budget, some legislative issues, staffing, facilities were all discussed. Public Health and WIC would very much like to be located next to each other, and I've mentioned this earlier, as we've been addressing the social services building reorganization. They would like to be located close to one another because of their connection. There were 2 more shot clinics in the month of May, and they were very well attended. People are getting their second booster. And then on the 24th, we had our work session, which Steve addressed. That went very well. And we have an AIS meeting scheduled now, coming up on the 9th of June. And I believe that is my report.
Thank you.
What was the segment, who, on the public health board, who were you targeting, or who did you want?
Oh,
You mentioned.
if,
She's looking for a couple.
we're looking for more folks who are willing to serve on that particular committee, public health. And we would like to represent every district, and I think it's Danny and our districts aren't represented on that. You know, if it were ideal, we'd have a representative from every district, but, and from multiple areas of interest, and K-12, the schools, we don't have a person who can bring some of that expertise to them.
Okay, it's good. I took that as
You were trying to
K
figure out
through
what K-12.
12.
Okay, yeah,
It's like a
a representative to serve on the committee who may have that interest.
third grader on the
Hey.
board.
You didn't want, if you didn't like me on the board, you sure wouldn't like my son Jack on the board.
Nothing to do with age or mentality, put it that way.
He's right in the prime though, 5th grade, so he'd be right in the middle, so if that's the case.
Find them out.
But good luck.
Take
Well,
it, Paul.
All right. We had a one watershed meeting in Hutchinson. We've set now our date for the public meeting. So we're about 3 steps into it. So when you say embryotic, yes, we really are.
Can I
So-
jump in and ask a few questions about the status?
About what?
The status of your One Watershed, One Plan?
Sure.
Are you guys, do you guys have a memorandum of agreement on that?
You have to. Bowser requires it.
Yes, so have you created that?
I don't think we worked on it again last week, polishing off, or 2 weeks ago, polishing off some of the things on it. So no, we haven't entered into that yet, but getting
Who are
closer.
your legal advisors on that? Are you sending them out to
I don't.
each?
I don't recall who the legal is.
Are you doing a cooperative or joint powers?
Believe it'll be a cooperative.
Excellent.
I think they learned that from somebody else's mistake where they went the joint power route. Evidently, that's not as smooth. So,
You lose some local autonomy if you go joint powers, but who's gonna be the fiscal host?
McLeod,
Excellent.
Yeah.
What's the plan called? What river?
don't
This
do
is a
this to me.
test, Paul, and you're not passing.
Don't
I'm
do
only
this to
asking
me,
you to
South
Say the
Fork.
crow.
What
How's
is
that?
it, South Fork?
I don't remember.
Okay.
You can't ask me questions on the spot like that. Jesus.
I'm concerned that my absence might cause, and I just wanna make sure it flows smooth for you guys, cause I've been working a lot with Danny's committee, cause he's,
The Mississippi Committee, not the North Fork one,
yeah.
but, cause the Mississippi, they're debating joint powers versus the memorandum thing,
check
and then
with Colton.
who's the
As long as you
fiscal
guys are
host.
doing well, I'm happy. So
Yeah, no,
sounds
I'll
like
check
you guys
with
are on the
Colton
right
Drager to
track.
make sure, cause yeah, if you are gonna be gone, if there's anything coming up, if we can move it up ahead and get it to you ahead of time, that would be good.
And if McLeod County's involved, they're a great resource, so I respect their guidance as well.
They're kind of the lead on this one. The
Excellent.
chair of our group is McLeod County. They're the fiscal host. It's, we have such a tiny portion of this watershed.
Oh.
I mean, minuscule.
Well, Mississippi, I don't think we're a huge portion of that either.
Less than 5%.
No.
Same thing with Wright County. They have such a small portion of this watershed, but yet they're part of it, so.
Well, thank you for that information. You're on the right track, I'm not worried.
Then we had UCAP, and I'm pleased to say that We approved $317,000 for the funding of the three-bedroom home in Eden Valley, so that's going to move forward. And then they approved $370 for the four-bedroom home. That seemed like a lot of money for one more bedroom, but it's an entirely different design.
17
of the
seems a
home.
lot to
So,
me for a three-bedroom.
moving forward with those two fairly quick now. They want to get rolling,
Houses are
so.
incredibly high though. I mean, so you gotta put a, you know, that number seems high, but houses are so out of whack right now.
You probably don't have to tell Paul. just
You
moved
don't
into
have to
one.
tell me anything about building a house right now. I just left my checkbook with signed checks in the front. They just fill it out.
What's your address?
God, it's bad. So, but
You
then
need
you
any
got,
beef, by the way? If that's the way you run.
Ramen noodles.
I'll take a check and then we'll get you whatever, you know. Sorry.
be some dead
You opened,
steer,
you're up for it, I had to take the shot.
be some dead steer laying out on my front lawn.
Yeah,
There's your meatball.
It'll be a calf, it probably won't even be a dead steer.
Pavel.
Sorry.
Had a CPT meeting. They have 6 applicants, unless that's changed since the last time I checked, for the new executive director position there. What's amazing is, the cash just continues to accumulate. As of the last meeting, we were sitting at $1,853,000. You know, but the problem herein lies, are we providing good service? We can have a great checkbook balance, but if we're not doing the service, we're not spending that money the way we should.
What-
So,
Is there, I mean, is there a balance where it should be? I mean, what does it take to operate? I mean, should it be $1 million?
have you ever heard the number for a 3-month period of expenses?
I mean, we could take it, I don't have what their full budget is, we could take that and divide it by 4, but
Yeah,
I don't have that in front of me right now.
I don't either, but
I was just, I mean, is that, I mean,
that's more.
Yeah, it's more than what's necessary. I think when we went through the strategic planning process, we determined around $500,000 or so is what they need to have as their reserve for emergencies. If there's a catastrophic issue, then that's what it would take for them to kind of get back up to buy new servers, and a building burns down and you lose everything. That's what it's going to take. So, but one of the challenges that they're running into right now, if you don't mind, Paul.
Nope.
Like everyone, staffing's become an issue, and being able to hire people who are experienced within the pay range. And so they're taking a look at making adjustments there, kind of, you know, they're mid-cycle as far as a comp study is concerned. So they're looking at doing an adjustment on their whole range for all the positions, and then making an adjustment for existing employees as well to try and match the market a little bit better. So,
And they're kind of doing that in an interesting way. They're gonna drop the bottom 2 and add 2 to the top on the
Yes.
steps.
yes, and then make adjustment to the whole scale as well.
Yes. So, interesting way of looking at pay adjustments and so forth.
It's an inexpensive way of doing it without contracting with someone, but what you lose with it is you're not actually seeing what the market is. You're kind of putting your finger up in the air and saying, where's the wind blowing? So,
We did bring up, or I did bring up doing the market study, but that didn't seem to fall on ears that were interested in listening. But we need a director. Staffing is an issue. Morris, Minnesota, I'm not gonna say anything about Stevens County, but you are a long ways from everything when you are in Morris, Minnesota. So, you know,
Except
if you're
there's
gonna,
a college right there.
you have a college, but you're
That
still,
does a lot of computer science
Yes.
stuff, so that should be an advantage for you.
it is, yeah, they get a lot a staff
For
coming
the
in.
cost.
how many staff?
You
How
get a
many?
master's
18.
degree in computer
18
science from Morris, you really have something.
Yeah.
I mean, that's a good
but that's
school.
also worth a lot of money in the open market. And
That
we
might be
haven't
what
been
we have
willing to
look
pay
at. Yeah.
well, we won't even identify what the open market price is. We won't do the market study that's conducted by a firm. They wanna do their own, so you tend to not have it. But I'm hoping that once we get a new executive director in place, that is gonna really help get things. I am concerned because, and you guys know I'm a little old-fashioned on this work from home stuff doesn't always play well with me. And, especially when you're hiring an executive director. I think that needs to be on site, but, you know, we'll see. Prime West meeting, of course, you've all heard about that because of Bucky's Bar. But we had a very
Is that
interesting,
the highlight? Probably would be in my mind.
Times they're long.
but, we had a significant debate about adding another holiday. And it became down to a point, it was very divisive in the room. Many thought that, the number of holidays we had was enough. And that was the way the vote went. So if you're
Oh.
gonna add one, then we gotta drop one. And I think that's a fair way to do it. It came down to a business decision. I did not have a vote. I'm the alternate there, but Beth and I were in agreement. The way she voted, I thought was the way it should have been, and she voted against adding a holiday, so.
How many do they have?
Well, somebody said, how many do you have? 10, and then he goes, well, actually, we have 11.
Yeah.
Which is what, I'm trying to think what we got.
Ours is 10 or 11.
They wanted to add Juneteenth, you know, and so it got really ugly, and I said I would be willing to swap one, that's fine, but I'm just gonna leave it at that.
Yeah.
It's
It was
a
divisive.
no-win vote, it just.
It came down, let's make a good management decision here. Let's wait for the federal and the state iron out this federal holiday, and if they say it will be observed, then it will be observed, and we'll have to comply, but until then, so you guys may run into that come negotiate.
My question always is, who are we missing?
Well, that's what the
Yeah,
question
I mean,
is,
if
isn't
you're
it?
going to
Exactly.
pick Alphabet Day.
Somebody
I'm
said get
sorry,
rid of
'cause I
Columbus Day, and they said, well, you
all
can't call it
acronyms,
Columbus Day, and
I'm
I
not
said, well, there you go then.
Picking or choosing,
Bitching
but if
and
we're gonna,
whatever. It just-
you're gonna miss somebody, so now, 2 years from now, we're gonna have the same argument about the two groups you missed, then we're chasing our tail, and can we?
Well, here's a good
leave?
argument, how come when you have a holiday to honor, say, veterans, but yet you'll go and you'll find veterans working? If we're gonna honor veterans, they should all have the day off, the rest of us should have to work,
It doesn't work that way.
you know, so.
It really doesn't,
But-
so, anyway.
Well, I always say that about if you're, if you're old enough to fight for your country, you should be old enough to drink.
Yes.
And I said, absolutely, but sign up. Sign up, and you can drink. I got no problem. I mean, that's the deal, and it's both sides. We're in this together.
Yeah.
Oh, I'm off. So,
All right.
We have
so
10
let's-
sometimes.
That endeth me.
Okay,
That's
so
all
I
right.
didn't have a lot either, surprisingly. I had, we did the closing on the property at 701 Sibley.
Congratulations, Chair.
We just finally closed on that.
That is good
finally
news, Miss Oak. Holy crap.
That was,
That is revolutionary.
that was on the first of June, wasn't it? Wednesday,
June 2nd.
June 2nd. Okay, June 2nd.
We should have a holiday.
And, the last time I saw the check, it was in Andrew's pocket.
Whoa.
Last time I saw the check, it was in Sharon's.
Yeah.
So that was done.
I would assume Dollar General will be digging quite soon, cause usually that's
I would assume
their business model. When they close,
It was an interesting closing according to Woods. They had some last minute questions and just things, so, but anyway, it's done, so they did a good job. I also had, I didn't have a lot, I also had, the shelter meeting for Meeker County fundraising. We're gonna do, a bowling tournament again and probably a breakfast, so that's kinda where I'm in the planning stages, trying to find a date. I'm thinking maybe in October is what we're kinda shooting for. And we're gonna do a breakfast that same weekend, Steve, so we'll probably be calling on you to fry.
Look.
However, I know,
French toast.
hopefully I will be fully out to pasture by then, so I think we're gonna do it at the Legion, but we will see.
Danny, you got any room in your pastures? She's
I
looking at
don't
both.
know.
Hopefully I'll be fully retired by then. So-
There's a lot of ways I could go that
I'll
route in
never-
terms of,
So, it seems
but I
like-
think I'll just stay
Yeah,
quiet
that might be
this
a good
time.
idea. And that's all I had. It was, been kinda quiet.
You got in enough trouble last week.
Yeah, there is one more thing I wanted to elaborate on my letter is I called Ashley yesterday and I told her I thought she should send the 3 letters to the full board And I asked her to send my letter to the full board of Woodland Centers also, because I thought it was all pertinent information. So that's it on that.
Okay, anything else? Thought I'd look for a motion to adjourn.
So moved.
Oh,
Oh, you were late.
I always thought Steve loves that part.
second.
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 Third.
We're adjourned. I never vote on that. I just say we're leaving.
Done.
Stop.
Hey, guys, we
Stick a
got a
fork
big
in it.
benefit though. Barb Locke wasn't in here to make us do a whole bunch of training for the Board of Equalization meeting this time.
I asked her to update on.
Not yet.
She's right here.
I'm